You don't have to hate people. Racism means simply that you likely don't consider them to be people in the first place. Now, we need to take that into the larger conversation about this pandemic. Now, we could say, folks maybe, have their attention on one thing or the other, on racism or on the pandemic, and we don't necessarily see them as intersecting. But I'm going to get into how that happens here. A coalition of Black liberation groups and other allied organizations are planning to stage a protest when the trial begins in Minnesota. And one of the statements they've released is as follows, in part: the murder of George Floyd by these killer police officers is a devastating example of the many lives stolen at the hands of police in our community. Now, I can see why someone would ask, why stage a protest at the trial before it happens? Others may wonder, didn't you get all that you demanded? Chauvin was arrested, and he's now standing to be held accountable for his obvious crime. Well, of course, following these kinds of trials, following these kinds of cases, we know better, especially given the fact that, as I wrote shortly after Mr. Floyd's death, quote, in the preliminary details from the county medical examiner's autopsy appearing at the end of the complaint issued from Hennepin County District Attorney Michael Freeman, he said that there were no physical findings that support a diagnosis of traumatic asphyxia or strangulation. Mr. Floyd had underlying health conditions. This is a phrase we're going to hear a lot later, including coronary artery disease and hypertensive heart disease. The combined effects of Mr. Floyd being restrained by the police, his underlying health conditions, and any potential intoxicants in his system likely contributed to his death. Now, this is, of course, again, this is the Hennepin County District Attorney. This is the person who, ostensibly is supposed to be prosecuting this officer. And the initial conclusion coming from the government was that essentially Mr. Floyd was at fault for his own death. Now, the combined effects of Mr. Floyd, being restrained, as their statement said, I'm not sure what else you need to combine it with. The man had his knee on the man's, on his neck for 8 minutes and 46 seconds. I'm not sure what, underlying condition wouldn't lead to someone expiring under those conditions. But as we know all too well, America remains a nation where if you are pretty much anything but white, anything but rich, anything but privileged in the ways that it hands out privilege, quite often the legal system tells us that our deaths at the hands of police are our own fault. Now, much, unfortunately, was the same when the COVID-19 pandemic began. It was only 2 days after Floyd's death, as you may recall, that America counted its 100,000th fatality from this disease. Now, just this Monday, the nation surpassed 500,000 total. So we're talking about from last summer, end of last spring till now, 400,000 more people died from this disease. And though infections and deaths have slowed of late, in large part to vaccination efforts, we still continue to see America's original dilemma of racism joining with COVID-19 to target Black people and others of color disproportionately. Now, ABC News reported this week that per the Centers for Disease Control and Prevention, or the CDC as we commonly know them, quote, Black and Hispanic individuals are still twice as likely to die from COVID-19 as white Americans, and 3 times more likely to be hospitalized with a coronavirus infection. Now, for Indigenous Americans, it's even worse than that. According to that same report, they are almost 4 times more likely to be hospitalized with COVID and more then twice as likely to die from the disease. And the CDC's estimations throughout the past year, to be honest, have been on the low side. For instance, the CDC now counts fewer than 40,000 total deaths for Black Americans. But the COVID Racial Data Tracker, a collaboration between the Atlantic Magazine and Boston University's Center for Anti-Racist Research, run by Professor Ephraim Nehemiah, they had a count of 50,000 Black deaths from COVID-19 back in December. And they considered even that to be a possible undercount, seeing as that there are tens of thousands of victims whose race is still yet unknown. Now, the lethal effects of systemic racism, of course, are calculable, perhaps like never before. Yet there are ongoing efforts to lay the blame on the genetics of underserved populations. When the deaths of African Americans are shown to be disproportionate, and this is, we're talking about early on here, comorbidities or underlying health conditions became kind of the easy out for anyone looking to explain it. Well, yes, Black people have, higher percentages of asthma. In fact, people have higher percentages of, various other afflictions that, may lead someone to be more easily infected. But as Dr. Kendi wrote last April, that, quote, if Black people receive inferior care from hospitals and doctors, he wrote, are Black people to blame? If Black people are less likely to be insured, are Black people to blame? If hospitals in majority Black counties are overloaded with coronavirus patients, are Black people to blame? And we see this phenomenon echoing throughout all kinds of, everything from the actual healthcare itself to the way that folks in my business cover this pandemic. Too often Black pain is minimized, is dismissed, even by the medical professionals. Of course, as you may know, Serena Williams is a famous story about how she almost lost her life because doctors simply would not believe, that she needed, certain medications, certain painkillers. And so, we're talking about racism, again, as I mentioned at the beginning, it's not necessarily about what you intend, it's about the effect. And Dr. Kendi adds, according to the logic, that's that Black people are in fact to blame, racism would not be murderous. Quote, Black people are killing themselves. That's what he wrote. If that logic is to be held true, to be Black in America is to be suicidal, he wrote. Black people are to blame for showing up in so many morgues across this godforsaken land. Now, obviously these kinds of suppositions are ridiculous. But that said, we just had an administration that more or less its policy was to go by this understanding, and as a result, we've seen Black folks dying not merely just from COVID, but frankly from stress that this pandemic is exacting on people at large. According to a Vox report last May, and this has been followed up with subsequent research, Black Americans between the ages of 35 and 64 are 50% more likely to have high blood pressure, 3 times more likely to have kidney failure, and they're 60% more likely to have diabetes than their white peers. Now, these are all conditions that leave underserved populations more vulnerable to COVID-19. And while it's true that these are not genetic defects born of some inherent racial fallibility, there are reasons why these afflictions exist. And they are reasons, frankly, the white power structure in this country seems largely unwilling or ill-equipped to address properly. Racism is a healthcare crisis. And not even a pandemic, unfortunately, has gotten American leadership to collectively and effectively treat it as such. Part of the reason why I would say that it's blaming us for our own deaths is a method of erasure, not explanation. It's simply easier to do this. It's much easier to do this than to rectify the American systems whose flaws have been only more evident since COVID-19 first surfaced around this point last year in the United States. Now, I want to take you back a little bit further, going back to, you may have heard about the Compromise of 1877, around the time that the January 6th insurrection happened. Well, this is, of course, the Compromise of 1877 is when, essentially Rutherford B. Hayes and the, Southern, the Republicans, compromised with the Southern Democrats to essentially take the troops out of 3 key states that were there to help protect the progress of Reconstruction. And in exchange, they would stop their Donald Trump-ish protest of the election of the day. And about 20 years after this, after the Compromise ended Reconstruction and ushered in Jim Crow, generations of racial terrorism, W.E.B. Du Bois offered this lamentation from his childhood. It's just one question: why did God make me an outcast and a stranger in mine own house? Early on, we're taught as Black Americans, whether by intention or circumstance, to recognize the duality of both our identifier and our existence in this country. Black and American are what Du Bois termed two-ness, or quote, double consciousness. This sense, he wrote, of always looking at oneself through the eyes of others and measuring one's soul by the tape of a world that looks on in amused contempt and pity. Quote, he simply wishes to make it possible for a man to be both a Negro and an American without being cursed and spit upon by his fellows, without losing the opportunity of self-development. It doesn't sound like a lot to ask. It shouldn't be. Like Dr. King said in his final address, America would be true to what it said on paper. But unfortunately, this vision of Du Bois remains unrealized. And the dilemma of double consciousness for Black people and others in underserved communities is all too real right now in the era of COVID-19, as we contend with any number of all-consuming threats to our lives. Even as a vaccine emerges, we are faced with constant reminders of Black, Indigenous, Asian, and Hispanic and Latino mortality on daily. Whether one of the children in these communities gets a significantly worse education due to the complications of the pandemic, or parents worry for the safety of those kids if they're put back in school and subjected to possible infection. Is it not stressful either way? And does not this stress have a deleterious effect on our health? We've seen plenty of evidence of this already, just in these terrible last 12 months or so. Parenting writer Rashawn Meadows Fernandez offered last year that, quote, as Black mothers, we are living in an especially troublesome time, sandwiched between the current public health threat of COVID-19 and the long-term reality of police brutality. We are trapped in a double bind of racism. She continued, while there's an influx of pandemic grief guides, none are useful in teaching Black children that the virus is terrifying, but that racism is the public health crisis more likely to kill you. There are no instructions about where Black mothers are supposed to place their fears and their sorrow. Racism really is an American plague. It's America's comorbidity, in a sense, an affliction that left unchecked will continue to kill this nation where it stands. While COVID-19 seems to have a unique talent for exposing America's empathy gaps and the dangers of its hyper-individualism, racism and other assorted bigotries are the accelerant. Yes, Many of us, myself included, have pulmonary afflictions that make us more likely to contract COVID-19. Obesity, diabetes, chronic obstructive pulmonary disease, or COPD, all of these things are disproportionately prevalent in our communities. However, have we talked about why so many of us have these comorbidities? There may not be anything quite like living while Black in America, particularly during the Trump era, certainly to give us that kind of high blood pressure. And to get into that, Rutgers study published this January, January 2021, in the Journal of Racial and Ethnic Health Disparities, found that, quote, COVID-19 mortality, racial disparities in the US are associated with social factors like income, education, and internet access. So more detail about that. The study found that a particular county's COVID-19 death rates increased when there was even 1 percentage point increase in a particular county's percent of Black residents. Uninsured adults, low birth weight infants, adults without a high school diploma, incarceration rate, or households without internet. All of those things increased the death rate. So let's talk about the digital divide. Just, we're talking about households without internet. It almost doesn't seem like it fits in that assessment. But we're learning that not merely are people seeing their children fall behind disproportionately because they either lack sufficient internet access at home in order for their child to learn and to be participatory in class, or they lack simply the devices needed to have their child engage. There was a study by, there's a study by PRB that was published in September, and it found that, the digital divide is noticeably wider for children of color, specifically Indigenous children. And he said half of all Indigenous children lack either computers or paid high-speed internet at home. That's half of all of them in the country. More than 1/3 of Black and Latino children lack computers or high-speed internet at home. And that you compare that to non-Hispanic white children, only 1/5 of them lack those same resources. And so how do we propose to have, continue schooling at home with that divide? How then also do we propose to have them in school where the risk of coronavirus spread still exists and is still a serious danger? I mean, that is something that perhaps with vaccination can help fix, but then of course we have people rightfully having doubts about the possibility of vaccination, especially African Americans in this country, and they are leery for justifiable reasons. Okay, now there was a Pew Research report last week that said that Black people are especially likely to say that they know someone who is hospitalized or has died as a result of having the coronavirus. But also, that same report said that our demographic group continues to stand out as the one that's least inclined to get vaccinated compared to other racial and ethnic groups. Only 42%, according to the Pew Research poll last week, only 42% of Black Americans would get vaccinated or choose to get vaccinated, compared to 63% of Hispanic respondents and 61% of white adult respondents. Now, obviously, there are reasons for this. We are, people who has been experimented on in this country. We have been people who have seen, this doctor in Alabama, James Marion Sims, who performed experiments on enslaved women. And we've seen the pain and tragedy of the Tuskegee experiment. But what I would offer is simply, that, I would echo what I heard from a doctor earlier this week at a symposium. He said, all of us are, legitimately outraged by these historical insults, but remember that those people who experienced it were denied access to the drugs. And we're talking about the Tuskegee experiment here. Were denied access to the drugs that would have saved them from their disease. It makes no sense to be angry and furious about Tuskegee, he said, and then deny yourself the access to the drug that will save your life. We have to use common sense as we move forward. Now, of course, I think that certainly people have their freedom of choice, but we have to think about making sure that we have. I think about this a lot, being a person in the press. We have to make sure that we give people the proper information so that they feel like they're making an informed decision. That this I found is essential with people who have skepticism about the vaccine. And it's justifiable for Black folks to doubt the good intentions of the American government. We have been down this road too many times before. But as the doctor's saying, it's not only is it for the greater good that we do this, but it's actually ignoring the warning of Tuskegee to deny oneself the vaccine. And so what we need to do is, continue to educate folks about the efficacy of the vaccines. As we know, we just had another one, a single shot vaccine approved this week from Johnson & Johnson. We want to make sure people understand not merely that the vaccines work, but what they do in our bodies, and so people aren't alarmed by the initial after effects and discouraged from continuing on, because if they're getting 2 shots and they get bad after effect after the first, we need to make sure that they come back. And it's simply what the demands of this disease on our society have required us to be more selfless, have required us to think more of our neighbors than perhaps ever before, at least in our generation. And sadly, I think it's inarguable that we have not met the challenge. And whether that's a failure of education, whether that's a failure of culture, or the fact that the last presidential administration seemed to use masks and safe behavior as a cudgel in a culture war. It's important that we continue to help people understand that these kinds of things can benefit them. And if we have, it's not merely as easy as just saying you're wrong about this and you're wrong about that. You have to help educate people and meet them where they are. And I've really felt that it's been key to my journalism, and it's been key in terms of how to persuade people. But I also think it's borne itself out throughout history as a strategy for getting people to understand precisely what is important and why it's important and when it's important. I mean, of course, we face a very weighty list of statistics, and it's not unfortunately getting better for Black folks. As I wrote last June, there's this inordinate jeopardy that Black people continue to face during the pandemic, and still that wasn't enough to keep restaurants and stores closed. It wasn't enough to get people wearing their masks properly and isolating. In fact, as we saw, the right wing use those gestures in sort of a gendered attack, as if to say that wearing a mask makes you less than a man, or wearing a mask makes you soft. It's it's these kinds of toxic misinterpretations, willful misinterpretations that frankly are costing lives even today. And using those measures as political fodder and playing games with the health of millions for the sake of petty politics, certainly we need to see a concerted effort from the new administration to find ways to combat that with results. Now, municipalities are suffering from COVID-19, not merely because of the debts that everyone has been going through and enduring, but frankly, because a lot of businesses are closing up. A lot of economic lifelines are closing up. And we're seeing resistance, of course, on the Republican side of the aisle in Congress right now to $1.9 billion, trillion, aid package. And it's a package that simply, could offer a massive boost to the economy, as well as make sure that people can keep putting a roof over their head and keep getting medical care if they don't have insurance. So about all of this, all these businesses failing, I mean, we really want to see, instead of city governments having to pay police overtime, out of their strained budgets, so they could deal with people boarding up their businesses and having these kind of irrational panic over Black Lives Matter protests. What we need to be seeing is, people understanding what the real dangers in our society are, and what those real dangers are. They involve domestic terrorism, such as what we saw with the seditious assault on the Capitol on January 6th, excuse me. But we also need to see this country come to a different understanding about the spectacle of Black death. I mean, disproportionate Black death has been something to which America has been so accustomed that they, it's really just accepted as a fait accompli when something like this happens. Once a pandemic starts, or say a state like Texas freezes over and loses power, or police violence spikes, we know who is going to suffer the most. We're used to being the first to die in the horror movie. And what are we living through now, if not that? In the age of COVID, amidst the violence of white extremism, wealth and health gaps, environmental racism, and so many other ghastly nightmares. I mean, when ProPublica reported in just April of last year, they were one of the first to say that Black folks were suffering from COVID-19 at a disproportionate rate. They drew attention even then to the why. And it's damning. Quote, environmental, economic, and political factors have compounded for generations, putting Black people at higher risk of chronic conditions that leave lungs weak and immune systems vulnerable. Talk about asthma, as I have, heart disease, hypertension, and diabetes. In Milwaukee, simply being Black means your life expectancy is 14 years shorter on average than someone white. And that was before the pandemic really hit. They also reported that African Americans made up almost half of Milwaukee County's 945 cases at the time. It seems low now. And 81% of its 27 deaths, again, this is April of last year, in a county whose population is 26% Black. So 81% of the deaths in a county that's 26% Black. And Milwaukee, there's lots of Milwaukees all over the country right now. I mean, Milwaukee is one of the few places, thankfully, that started the trend of tracking the racial breakdown of people who have been infected by the novel coronavirus. But and while some other municipalities and counties and states followed their lead, including Cuyahoga County, we we see the data out there, but it's not all assembled in one place. It's difficult to find, and frankly, it's much like, the process of trying to get a vaccine right now. I mean, everything is a bit haphazard, and it's if you find what you need, there's a bit of luck involved. I mean, think about what's happened in Cuyahoga County alone. I mean, in April of last year, white patients, 44% of the county's cases, they make up about 64% of the population of the county. And conversely, Black patients at that point comprised 39% of the cases, while only making up 31% of the county's population. And things only got worse statewide for Black patients. I mean, African Americans make up 14% of Ohio's total population, but as of October, state data was showing that they were 27% of those hospitalized with COVID-19. And this is a nationwide problem. I mean, in Washington, D.C. alone, just this week, the death toll reached 1,000 people. And according to the New York Times, 3/4 of those killed by the disease were Black. The impact it goes beyond, of course, as I mentioned, health. It goes to Black-owned businesses. I mean, it's the impact, according to a Federal Reserve Bank Cleveland study last October, was outsized, noting that, quote, as the pandemic has unfolded, data show that COVID-19 sparked either the temporary or permanent closure of minority-owned firms at higher rates than non-minority firms. The bank's analyst added that a National Bureau of Economic Research working paper estimated that between February and April of last year, the number of actively working, self-employed Black business owners decreased by 41%. It's the largest change of any racial group that the study covered. And it was clear that, from the start, that these businesses would need help. But of course, they by and large could not expect it from the Trump administration. I mean, and not merely that, but the Trump administration operated what essentially was a corrupt and ineffective PPP program. And we saw how disproportionately, drastically disproportionately, you saw funds from that program going to white businesses, or funneled really to white businesses who had access to banks, big banks, because of the amount of capital that they were able to maintain throughout the course of the pandemic. So when you have when you have an inherently unequal system, okay, and then you introduce Trump economics to it, then we end up with the PPP loan program that we saw last over the course of the last year. The PPP loans, I was going to I have to quote myself here a little bit, but it's just essentially it was almost like a tool to further widen the racial wealth gap. And so, unfortunately, we did not see enough of a, I guess, a pushback, on a political level, from the other side, so that they could then say, hey, we're going to, have, these particular, other programs, local, available statewide, or we're going to, point out the utter sort of corruption and criminality of what was going on here. None of that really took place, and it just sort of faded into memory after, people, struggling, really since the beginning of the lockdowns. So if you're talking about lockdowns hurting businesses, as Republicans often do, and they make it a talking point so that people start protesting for these rules to be lifted, despite safety concerns, they're not acknowledging the fact that they didn't do nearly enough to help people when they needed it. And this is, frankly, something that, we could be also talking about with regards to education. I mean, the Trump administration used the pandemic, sort of Betsy DeVos, who was then the education secretary, as a way to essentially play favorites, using federal funds to for-profit schools, directing, monies to the kinds of schools that she favored, as opposed to, making sure that public education had what it needed in this country. And so when you see this lack of response, when you see the utter kind of, corruption and incompetence, I mean, there's the temptation is to ask, could we have seen this coming? And yes, to a certain degree, we could have, because Puerto Rico, what happened in Puerto Rico in 2017 was essentially a precursor to this. And I spoke with the mayor of San Juan last year about this. And, one of the things that she said, aside from, noting that, the former president liked to play golf while people were dying in, Puerto Rico as a result of hurricanes Irma and Maria, this happened, in September of his first year in office. And what she said to me was that, there was still a little bit of sense that some people may have given him the benefit of the doubt, like, hey, maybe he can figure this out. But we knew, based upon the Puerto Rico response or lack thereof, what this administration would do. And still, we don't have the safeguards for the underserved, for the indigent, to survive a crisis like this. We rental protections will expire one day. People will not necessarily have access to the vaccine before they need it. And at this point, it's still too much of a free-for-all. And we need to have, a serious reckoning, with regards to whose, for lack of a better way to put it, whose lives matter in this country. Do they all matter, as the right likes to tell us? Or, is there something else going on? I mean, it was in this culture, in this culture war that I mentioned earlier. I mean, you saw Republicans opening up cities well in advance of any kind of safety protocols being carried out or being instituted. And who suffered the most? Workers of color who were, in the nail shops, in the barber shops, in the stores, bagging groceries, and exposed to people who did not have, proper safety measures in mind. And so one of the things I wrote about at the time was, aside from the businesses that would not recover in all likelihood from, what happened, you had people like Texas Governor Greg Abbott, cognizant of the dangers of the disease. At the time, it was reported in Daily Beast that he knew that opening up the state would lead to greater transmission of the disease, but he did it anyway. He said on a private call, quote, "The goal has never been to get transmission down to zero." Well, what should it be then? I mean, ultimately, what end is served by opening up, these various, restaurants and businesses and what have you, other than, of course, obviously keeping those businesses afloat. But I mean, for how long if everyone gets sick? So the thing is, we have to understand, yes, death overtakes us all at some point, but we're being told to numb still. We're being told to numb ourselves to mass casualties and the increased possibility of us being infected by COVID-19 so that people can feel that they have grasped some sort of normalcy again. And this, while we're thankful it's not coming from the White House anymore, as opposed to before, it's still incredibly dangerous for us to be thinking about trying to open up the society while we have not yet fixed the underlying conditions that have made Black and other people of color more susceptible, more endangered by this virus. And again, if we're not treating racism as a public health concern, then we're doomed to repeat this, because the idea that there will not be another pandemic, or that there's a possibility of COVID variants, becoming more and more serious, we're going to be doing this for a while. We need to reorganize our society around this. And if we have the capability to do that, then we sure have the capability to address a lot of these systemic flaws at the heart of the American system, what I call the holes in the boat. And if there is any good thing that happened out of the Trump administration, it's this one thing, and it's the fact that he helped make those imperfections in the American project all that more evident. And it'd be a shame if we frankly just did nothing or not enough to address the issue at hand. I spoke to Brian Stevenson, the co-founder and director of the Equal Justice Initiative in Birmingham, Alabama, after when John Lewis died. I asked him about reconciliation, truth and reconciliation. Like, what does this country need in order to get past its wounds, get past its issues, get through to a period where we can actually work constructively to end racism in other forms of oppression. And perhaps we need a Truth and Reconciliation Commission, because frankly, we cannot move forward effectively if we still have this many Americans believing that this is the truth, and when it actually isn't. I'm a lot less concerned about people being reticent to take a vaccine because of the government. Obviously that's worrisome, but I'm certainly not as worried about that as I am about people who completely believe utter falsehoods and fantasies. You believe that Donald Trump is going to be inaugurated next week. Yes, there are people who believe that. And until we have once again at least some semblance of an agreed upon truth or set of facts, then we're going to be doomed with regards to any kind of effective response to this virus. And it has to be not merely a medical response, it has to be a cultural and a philosophical and a moral response. And it simply has to be, it has to go beyond policy in a way. And we see that because we know how dangerous racism is as Black people, as Indigenous people, and Latino and Asian people certainly are being reminded of it thanks to the scapegoating of the virus on Chinese and other Asian peoples. We're all being reminded of how dangerous a force this is. We didn't need the Capitol to be overrun in order to understand that. Maybe some people did, but certainly we did not. So it's time for collective action that goes beyond Black History Months. It's time for collective action that's built around strategy, around solutions, and frankly, with the memories of people whom we've lost in mind. And certainly there are innumerable losses, stemming from the deaths of the 500,000 plus who we've lost to this disease. But I also think about, right about now, I think about Breonna Taylor. I think about Ahmaud Arbery. I think about George Floyd. And I think about how in each instance, just like with COVID-19 and this whole stuff about comorbidities, they too were blamed for their own deaths. And with Breonna Taylor, I mean, the anniversary of her death is coming up in 2 weeks, March 13th. And this is a young woman who was an EMT who we needed out there, helping people, saving lives. And I just ask that, as we consider the statistics and we look at all of these amazing things that these presenters are going to offer over the course of this weekend, I just ask that we keep in mind that there are so many ways, unfortunately, to kill us in this country, and so many ways it seems like this country is trying to kill us. And we need to understand this as part of a larger struggle. And with that, my hope is that with a broader perspective, we can achieve even greater goals in the end. And I follow James Baldwin's philosophy. I can't be a pessimist because I'm alive. And let's just make sure that we stay that way. Thank you for having me today, and I really do appreciate the invitation from Cleveland State.
Thank you so much, Jamil Smith. That was powerful. We know much of what you told us, but you put it in such a strong perspective. So I really thank you for that. And thank you for the James Baldwin quote. It's powerful. I don't know about you, but I'm even more energized to keep working to advance our communities. What stood out for you? What caught your attention? Please let us know. You just heard a powerful speech by a wonderful journalist. Please drop something in the chat, drop something in the Q&A, and let us know your response. Thank you so much. Thank you, Mr. Smith. Appreciate you. Bless you.
Thank you. Thank you kindly. I appreciate it.
Up next is our first artistic break of the day. This is a time when you can stretch your legs, grab a break, grab a beverage, and hear from one of Northeast Ohio's artistic gems. Then following the break will be our first panel session, focusing on inequalities in our healthcare system and led by Dr. Greg Hall. Considering what we just heard, we just got a good beginning to that session. This first break features poet Ephraim Nehemiah. Ephraim is a writer, educator, and nationally touring performer whose poetry has been featured in many publications, including Anxie Magazine and Lake Effect Anthology. Their performances have graced the stages of TEDx and Button Poetry, among others, and they had their visual artistic debut last year at Spaces Gallery, right here in Cleveland. I present to you Ephraim Nehemiah. Welcome.
Hello, hello, hello. So glad to be here. Thank you so much for having me in the space. And yeah, I'm just ready to get into these words. So I do come from a performance background, and so I got so accustomed to like being in the presence of people, and it was definitely an adjustment being online because yeah, the people ain't right in front of you. But even if I can't hear y'all, you know, if you in the comfort of your home, still feel free to react to anything you hear, to snap to yourself, to make some noise, and you know, it'll travel through the airwaves. And I'll feel it in my spirit. So the first poem that I want to get into, as I took poetry more serious and began to be in more and more spaces, and like I said, coming from a performance background, there was so many poems that spoke to social justice and tried to highlight the ills of the world. And I love that this took place. And as I started to focus more, I noticed there was so many criticisms of different systems of oppression, but a lot of times I'll see a lack of criticism towards the effects of capitalism and towards classism. And also started to think about like what barriers are keeping people who are dealing with these oppressions the most from being in these spaces, and how sometimes even as we try to highlight things, right, there's always something that we might miss. And, you know, being under the poverty line my whole life, I'm just now starting to get over it. I felt compelled to speak to my personal experiences, and also highlight that, and especially just, like I said, seeing the ills of capitalism and facing the effects of it, while at the same time often coveting what other people had, and figuring out how to navigate having both those feelings. So I'm getting to the first poem. I grew up the brand of poor. We don't ask our parents for money, our parents ask us. I remember counting down the days till 16, because that's when I could legally make my own money. In high school, my whole check was spent before I clocked in. I made just enough to keep the lights on in the fridge, but not enough to put food in it. My first time helping with the bills, I was 7 years old. I spent summers scanning concrete for loose change to feed to my prospering piggy bank, and just for a surprise expense from my parents to have them saying, "We gonna pay you back one day." And how? Stable housing is in an on-again, off-again relationship with my family. We was staying in my uncle's broken down van till Deacon Lowe took us in, then kicked us out. Now we have my aunties with a new job. I witnessed my cousin grab some food without asking a single soul for permission, devoured it. That's when I found out some folk grew up just eating food whenever they was hungry. But I'm older now, and freshmen are swapping childhood stories. I get to talking, and I notice awkward walks into the room. I'm expecting relatability, and I'm served misguided sympathy, like I'm the only one whose family is under the poverty line. So I take the same tale to an open mic. I see skin like mine, and I think we're about to kick it. And that's when I realized these are the type of bank accounts you bring up to prove poverty culture and Black culture ain't the same thing. So I try to escape all the stares of pity, cover it up with a, hey. I mean, we learned how to make a way out of no way, though. I may be broke, but I ain't broken. I ain't even broke for real. I'm just in between blessings right now. I casually talk about my life, and it sounds like a change rattling in a cup. I make it seem like none of it fazed me, and it sounds like a lie is coiled around my mouth, and I'm to blame for code switching into a higher tax bracket. Learned all these new words and pronunciations and new looks just so I could sound like these new friends don't even be wanting to relate to my childhood, but I'm so defined by the lack. I feel like I lose myself by gaining something. Like, who am I when I leave this penniless past behind? I ask, like I'm actually in a position to, trying to remember where I came from before going anywhere. But what is being broke if not imagining being rich? Because truth be told, I be hating these rich men, but man, what I wouldn't do to be rich, man. How am I supposed to love the past that made me if I'm constantly running away from it? I know full well what capitalism does to its poor, but don't tell my activist friends that I'm trying to get a taste of it before we abolish it. I'm just tired of surviving. I don't ever want to be broke again. So go and ask me, will it profit someone to gain the whole world and lose their soul? I don't know, but I've been dying to find the answer. You know, I would hear a lot of times people say, don't have children if you can't afford it. And I would get so defensive when I heard this, right? Because I felt like people was cursing my family, saying as if I shouldn't be here. And definitely, right, it's always good to have so many resources. But when I would think about how I came up and still being grateful for the lessons I would learn, it, like I said, I would get defensive when I would hear these things. And becoming a parent really taught me that even as you try, right, to read these different books and take these different classes and receive all this information to help you prepare. In a lot of ways, there's really no way you can be fully ready. I just feel like there's some things that come, especially for me as a first-time parent and raising a child, where it's like, this wasn't in no book. I couldn't get this from somewhere else. And even it was, some things you just have to experience. And one of the things that I was really unprepared for, one, the way that gender impacted the expectations around parenting, but also the way that impacted the perception of the child. And so there'll be so many instances where I'm going somewhere with my son, and the way people would casually sexualize him. And it was just seen so normalized. And the way they'll talk about, oh, there go, my little boyfriend, there go my husband. Oh, and they were talking about a child. And the way, especially Black boys are sexualized at such an early age, and how it seems so normalized, right? This was something that I wasn't able to be prepared for, even though it was something that I experienced in my own life. And I originally started a poem to talk about the way people were abused. And I was like, oh man, I have to speak for the people that don't even have a voice. I gotta highlight what's going on over there. And then an interesting thing happened where I didn't even realize I was telling my own story. And there are some times where it's like not until I wrote about it, right? And when I was trying to expose what was going on with other people, I realized I was digging up my own burials and my own graves. So I push a stroller across campus. I hear, just wait till he gets older. I say, stop sexualizing my son. I watch the room burst at a joke I ain't tell. I smell the scent of all the red flags spreading like feathers. Grooming is the process of lowering a child's defenses to further victimize them. It begins with targeting someone young and vulnerable, gaining trust, introducing secret rules sacred as scripture, finds needs, promises to fulfill, demands a private place to practice. And this is the best example I have for religion. A flock flying under the same gospel, vultures preparing funerals and calling them baptisms. And I'm the outcast for pointing out how foul they sound. My toddler is christened a little man, a lady killer, a playboy friend, too cute for his own good. And they greet me all like warnings. Then they do compliments, love and danger cocktailed for consumption under the supervision of a God's loving hands that damn the undesirable. I do not blame the church for all the world's sins. I blame them for claiming they could save me from them. Yes, I was a meal before. What good is being saved and sanctified if I'm unable to rescue myself? Under the Lord's watchful eye, I was given a testimony, a trauma to bury and then unearth. Anyway, it happened. It happens. I ain't think nothing of it. I just stared at the tomb of myself and figured at the cost of living until I had a son. And I shivered at the fear of boys made meals. I ain't afraid of a metaphor, I'm afraid of memory. I push him and stroller across campus. Here, there go my future husband, like the only religion these mouths know is predator. Harmed, folded into a laughing matter, assaults labeled the first time. My child seen as another sacrifice, so I decide to rewrite my own gospel. I refuse the whispers. I swear that this past will not be passed down, that my son can stand to any false god that promises salvation and be his own savior. Ain't that what it means to be a parent sometimes? Trying to live on our own dreams through our children. So I was raised in the church. And Church of God in Christ, for those of you on all the denominations. That's actually where I started performing. And so I started taking writing seriously a lot later. And I would always think, I would hear so many poets be like, oh man, I've been writing my whole life. I was 4 years old and I have a journal. And ever since then, I knew I was gonna be a poet. And like, that was not me at all. And I didn't really come into myself as an artist until my early 20s. And I was like, man, I feel like I didn't have no beginnings, focusing on these things as an artist. And then I started to think back like, no, we was performing in the church heavy. You know what I'm saying? Every Sunday we had to get up there, whether we was doing, reading some scriptures, whether we was doing the Easter service where we read some church poem or singing, even though I couldn't sing. Most of the people in my family played an instrument. You know what I'm saying? I didn't really practice, but I wanted to play something too. So I had a little harmonica because, you know, it didn't take a lot to sound good. And I remember sometimes my brothers and sisters would ask, like, oh, let me play the harmonica real quick. I'm like, no, you're gonna take my shine. It's the only thing I can do. Y'all gotta stay back. But yes, I realized I did start performing early, and the church, and those was all my first experiences. And my mother was heavy in the church. You know, she was a preacher. She prayed like nobody's business. She was on it. And I remember as I started to creep a little further away, and I would hear about people speaking on spirituality and these other faith-based systems, I think the one thing that didn't keep me from, you know, completely disregarding the Christian household I grew up in was that my mother is the most spiritual person I've ever met. In terms of using her faith, in terms of putting it into practice, in terms of manifesting things, you know, I couldn't discount her God because what I seen her make happen. But I wasn't all the way over there, and I think what really planted the seed. I remember I was raised in the church, but I was also raised to be proud of my Blackness, you know. And so I remember thinking to myself, like, all right, bad. We in America, we learned slavery happened. We learned Christianity was used during that. So I remember, you know, talking to my parents like, yo, so you saying, you know, no man can come to the Father but through me, right? That's scripture. That and so I'm like, all right, you also saying they wasn't practicing Christianity in pre-colonial Africa on the continent. And so it was almost as if our salvation came through this terrible traumatic situation. And that was a lot for me to wrestle with. And I think that's what caused the shift for me to start to drift away. And, you know, later on, I learned that there was, you know what I'm saying, these other forms that mirrored Christianity that wasn't brought by Europeans coming over to the continent. But I think that rift was already caused. And I know this separation in my faith also caused a lot of distance between me and my mother, because it being such a stronghold for her. And it wasn't just me being departed from her faith system, right? It was me drifting towards the fires of hell. And I think it's interesting when we have these parent-child relationships where you're introduced as, you know, this guardian, but almost this deity, right? Like you have all the answers, take care of me, all these things. And it's a very interesting process to learn the humanity of your parents, right? And I remember there was a day where I was sitting there, I was like, my mother was telling me a story, and I'm like, yo, you a whole human. And it was a weird thought to have, but like, I didn't see you like that before, right? You were my mother, you was this other person. And when I would think of the things people go through and the emotions they have, I didn't necessarily put those on you because of the way the parent-child relationship was set up. And it's so interesting to learn someone who you've known your whole life. And I don't write poems about a lot of people, actually pretty much nobody. My mama actually ain't even heard this poem, but you know, not obviously, because it's different people, but she did shape so much of my life. And so I wanted to speak to that. So my mama prays. I love my mama. My mama loves God. And our house wasn't no curses, just Bible verses we recite like daily affirmations. Mama's saved and sanctified since 11. She say Happy Resurrection Sunday because saying Easter is low-key blasphemy. My mama's palms are 2 tambourines banging to a rhythm you can only play if you have that extra arm fat, and attended like 525-second services. I was raised Church of God in Christ denomination. Gospel praise echoed with the sunrise. The TV stayed on TBN, and every 31st we prayed the new year in. The first healthcare plan I ever knew was her clasped hands and bended knee. Can I testify how my older brother was diagnosed out the womb with Hirschsprung's? Mortality rate of 80% that was even higher in the 80s. My mama prayed till his survival came to pass. Can I testify how my sister got so sick we actually went to the doctor? Hospital delivered the verdict of Crohn's disease. Supposedly, there is no known cure, but my mama's God don't understand the words no and cure put together. She prayed so hard, they couldn't find a trace of it in her body. Can I testify how in 2015, I get T-boned, flipped over, collide with the truck, and I crawl from the wreckage without a single scratch on my body? Come on, you can't tell me my mama ain't got God on speed dial whenever she prays. I can feel the anointing oil pressed on my forehead again. I'm in the middle of taking the finest communion. I'm talking about them fancy unidentifiable wafers that's pre-attached to the cup with juice so good it might actually be the blood of Christ. My mama prays, y'all. And I done backslid so much my spirit be moonwalking. This is the catalyst of every argument. She perceived forbidden fruit and serpent skin. Mama taught me, train a child in the way they should go and they will not depart from it. And I know the path I blaze does not follow in the footprints of my mama's church shoes, but I remember I've never met anyone more spiritual than her, seen her make prayer reality too many times to doubt it. So some days, yeah, I make a safe place in my soul for rebellion, dismiss any scripture that's filled with judgment for my life. But other days, I poured a sympathy for how she loves the brimstone she sees coated on my soul. Because family, it brings you the closest to people who have the farthest convictions. And maybe this one of them Bible type lessons. Our relationship all trial and tribulation. Us still learning the human behind the family title of son and mother, but it's still a bond that I can't imagine my life without. I'm still gonna love my mom. And ain't that the Christ-like thing to do? Boom, boom. So thank y'all so much. I saw a little question answer situation at the top. If that was supposed to happen in real time, I feel like I got like a super hot second. My timer stopped though. So if I don't, y'all could throw a question like, no, Ephraim, stop, your time is over. But yes, if there is any, I'll be more than glad to take those for the quick second. But once again, thank you so much for this experience, allowing me the opportunity to share my work and share my art. Yeah, I'm just grateful to be able to say the words that are near and dear to me and to have people who can listen and receive them.
Thank you so much, Ephraim.
Thank you. Peace, peace.
Hi, I'm Dr. Greg Hall, and that was Ephraim Nehemiah is a true talent, a true artist, really just amazing, and it had me thinking of my mother, and it's just amazing. It's really almost hard to recover from that, so it's so powerful. But the program has been so outstanding so far. African Americans have the highest rate for hypertension, heart disease, stroke, asthma, kidney disease, colon cancer, pancreatic cancer, ovarian cancer. And then came COVID, right? Which we have a lot of that data we went through this morning. I'm talking about a disproportionately high risk for hospitalization and for death. And so we've gone, what my mom, like my mother would say, we've gone from the frying pan into the fire. We've had over 70,000 African Americans die since the pandemic began. And, when you think about 70,000, we've kind of got numb to what those numbers are. We know the overall it's a 500,000, but 70,000 African Americans. So if you're from Northeast Ohio, Canton has a population of 70,000, right? If you added Shaker Heights and Cleveland Heights together, you've got 70,000. So imagine losing everyone in Shaker Heights and Cleveland Heights. I mean, that's a lot of people as you drive through. And so we've lost a ton of people through COVID. And at a point in January, COVID was a #1 cause of death. Imagining above heart disease, stroke, cancer, COVID was the #1 cause of death. So we're at a turning point now where we have to kind of look at, what are we going to do going forward to try to recover from going from the fire pan into the fire. So let's dig a little deeper. I'm going to introduce our panelists. First, Dr. Sherry Dixon Williams is past president of the medical staff of the Metro Health System and a member of the Foundation Board. She's a certified board pulmonary critical care specialist, which puts her on the front line of the COVID pandemic. She's seeing patients, our sickest patients in Northeast Ohio at Metro Health. She's also a board member of the Cuyahoga County Board of Health, as I am as well. Johnny Chip Allen is the director of health equity with the Ohio Department of Health. He's been a member of the Ohio Commission on Minority Health for many years and works in partnership with national public health organizations, state cabinet level agencies, and a variety of public health programs to target services to disenfranchised groups, measure program performance, and assess outcomes. And so he's joining us from Columbus. Dr. Heather Rice, assistant professor and researcher from the CSU School of Nursing, and works as a pediatric nurse practitioner providing primary care and mental health services for children and adolescents in Northeast Ohio. Dr. Rice's research focuses on neighborhood conditions, maternal health, toxic stress, and infant mortality in African American women. She's currently the co-principal investigator working with the community organization Birthing Beautiful Communities, BBC. This project, Survive and Thrive, a New Future for African American Babies, is developing an explanatory algorithm to identify the causal links that lead to infant mortality. And finally, but not least, Dr. Celeste Collins is a researcher with a background in psychology, anthropology, and social work. Her most recent work examines interventions focusing on reducing African American infant mortality rates as well. She's also an investigator with that Survive and Thrive intervention with Dr. Rice and works with Birthing Beautiful Communities to examine the impacts of perinatal support services. Her most recent work examines the impact of COVID-19 restrictions on the delivery of perinatal support services. So we've got a distinguished panel of people who really know what they're talking about. We're going to sort of start with Dr. Williams and kind of give us an overview. What's your impression of the COVID impact on communities of color?
So thank you, Dr. Hall, for having me. Hopefully everyone can hear me okay. Great. And to my co-panelists, it's a pleasure to be with all of you today. I just have to say, I was able to catch most of the opening speaker's comments, Mr. Smith's comments, really resonated with me on so very many levels. And there are, I think, numerous impacts that have we've seen in communities of color from COVID, some of which have been touched on earlier. But I think as I reflect on all of the different impacts this disease has had, it leads to one, what I call common final pathway. So bear with me for 1 second as I talk about how coronavirus, basically COVID and the deaths that we have seen basically highlighted or illuminated what we've known all along, that there are significant health disparities in our community. And when you add a pandemic on those health disparities, you will get the outcome that we have seen. I think the other impact that we have seen is sort of the ongoing effect that it has, not just on the individual who is sick, but the ongoing effect that it has on their family members in terms of lost job and economic, people's businesses, the impact that it has on their children in terms of not being able to go to school, having to be homeschooled, sometimes with internet and laptop access, and many times struggling to secure those resources. We've seen the impact that it has had in terms of morbidity. One of the things that we know about coronavirus is that it can have lasting effects. And those lasting effects can keep people from going back to work, keep people disabled and unable to get back to some semblance of normality. And then we've also seen, because we've had to be safe, the isolation and separation with people having to stay in their homes. And so when I think about all of these effects and I come down to the common final pathway with all of these effects, I find myself saying, what have I seen as a provider, both in an outpatient pulmonary practice where I'm talking to people on the phone every day for my clinical practice, as well as taking care of patients in the ICU who are dying and who are clinging to life and their families that are hoping they will get better. The final common pathway is actually a heightened anxiety, a heightened anxiety, a heightened fear. This anxiety and fear is, will I ever get better? Will I ever get back to work? Will my children be okay? Are they going to be behind in schoolwork? Am I going to find another job? Is my loved one going to die? It is a heightened anxiety. I think we have really seen that this pandemic has caused a real trauma, and has traumatized a people, uh, certainly ethnic minorities, African Americans, indigenous people, um, uh, people of Latin heritage, has traumatized people who already have borne a lot of trauma through the decades and centuries. And so I think if I had to point to a single thing, I would say that the COVID pandemic has left a lasting impact in terms of trauma and anxiety.
Thank you, Dr. Williams. That's, that I think that does get to the core I'm seeing a lot of traumatized patients in my office as well. I was traumatized by catching it and wondering all those things. Was I going to get better? Was I going to recover? Was I going to stop being short of breath? And so I think you've done that well. So while we put Chip Allen's slides up, and we're going to ask him to give us some perspective on sort of what the health opportunities look like, and specifically in Cowgate County, and sort of give us an idea of what sort of trends you're seeing.
Okay, can you all hear me?
Yes.
Great, thank you, Dr. Hall. One of the things that I'd like to do, and just starting off this talk, and we'll go back to the beginning, is first of all, thank Cleveland State for the opportunity, as well as to be on the panel with such distinguished colleagues. I need to make a disclaimer. I do work for the Ohio Department of Health, but I am not representing the Ohio Department of Health in this capacity. I'm doing it as a very concerned person in terms of health equity. Certainly support the mission of the Ohio Department of Health, but the comments that you're going to hear are basically my own as a health equity professional in Ohio. And with that said, I'd like to do one thing. When you start thinking about how do we really think about all the things that Dr. Williams talked about within the context of what she's seeing in her practice, and then how do we take these illnesses for COVID-19 and really begin to understand them in terms of the entire community? I'd like to introduce you to, we have a tool called the Health Opportunity Index. And basically what it does is it takes 13 social determinants of health. It uses this statistical technique called principal component analysis. But basically what it does is it allows you to really understand not only the overall health of a community or a neighborhood by census tract, but it gives you insight as to what social determinants are really driving health problems out of control in the neighborhood. So for example, and since we're talking about this, I want to focus my comments on Cuyahoga County and Cleveland. This is the Health Opportunity Index rendering for Cuyahoga County. And the way you look at this map is the areas that are the census tracts that are outlined in like the darkest hues of blue represent those neighborhoods that have the poorest or the lowest opportunity to achieve optimal health. And the reason why I want to be able to show you this, and I want you to pay attention to that dark blue shape, is because it gives us a lot of insight in terms of what people are having to live with. Now, it's also important to realize is that when you look at these neighborhoods, we're talking about census tracts and not zip codes. Please keep in mind that zip codes are really designed for the delivery of mail, but they're not precise enough. They're not designed to be homogeneous. So when you look at a zip code, for example, like 44120, it encompasses such a large area that you really can't really see what's going on health-wise unless you use a different level of geography. So those blue areas have the, again, lowest opportunity for people to achieve good health. But then if you really want to see what those look like, I'm just going to add a transparency. And you can see that areas even of Lakewood, but East Cleveland, Warrensville Heights, Bedford Heights, we all know Cleveland's racial segregation pattern. And if you look at who has the lowest opportunity in Cuyahoga County for optimal health, it tends to be shifted more on the east side, where we know a large proportion of the county's African-American population is, right? So then let's do something else. I want to talk about this thing called convergence. Now, the data that you see here is projected to Cleveland. It is a tool called the Burford's 500 Cities Project. And the reason why I like this tool, anybody can pull up these maps, and you can go to the CDC sites, is it allows you to understand where different health issues are at their highest levels in the city of Cleveland. So for asthma, diabetes, when you look at those different maps, you can tell by census tract, and this is, by the way, for adults, but you can see parts of the city that actually have heart disease or kidney disease, all of these issues that are serious. But one of the issues that we heard from our first speaker and some of the things that Dr. Williams alluded to is that when we start talking about these disparities, they're serious. But one of the things we have to start doing to really understand these problems within the context of, let's just say COVID-19, is we have to stop thinking of them as if they're just one entity. So let's do this. What the convergence allows us to do, I want to first take all of these health issues. And then what I want to do is I want to look at where they are at their highest level. So the top 40% of all of these diseases. But let's do this. Instead of looking at all this as one disease entity, let's combine them as if they were one within one data set. And then let's begin to ask the question, where could we find all of these conditions? So we would actually have a map of Cleveland like this. Now this is important. These are census tracts, right? A census tract has anywhere from 1,500 people to 8,000 with an optimal size of 4,000. But what you're seeing in every one of these census tracts is where every one of those conditions that I mentioned exist at their highest levels at the same time. So arguably, in the city of Cleveland, we would say that these are the most unhealthiest neighborhoods. And then when you start looking at a racial breakdown of that, it's no surprise based on what we've heard this morning, that 78% of that total population will be African-American. We look at it in terms of ethnicity, in terms of the Latinx community, we'll be looking at about 15,000 or 8% of the population. 191,000 people are actually living in our city in neighborhoods that are the sickest of the sick. But there is even more to this. So then when we start acting, we heard about issues of infant mortality. This is data from the Ohio Department of Health, prematurity rates between 2013 and 2017. And what you see in those dark colors is where you actually see the highest rates of prematurity, which we know is a real risk factor for infant mortality. When you then say, well, where can I find the highest 40% of where birth outcomes are the worst? We actually see that same type of Eastern kind of shift in terms of birth outcomes. And then when you start asking who's there, once again, out of those census tracts, 172,000 people in those neighborhoods, the majority of them are African American. One more thing. When we start looking at health opportunity, and I wanted to actually be able to begin to show all of this, because in order to see the pattern, you got to step through this. So this is the health opportunity map that I showed you. Again, the darkest areas have the worst health opportunity. When you begin to start asking the question, well, let's figure out where the birth outcomes are the worst. They tend to be in those areas that have the worst health opportunity. Then we said, well, let's look at those chronic diseases, those convergence. Remember, when all those health conditions are at their worst level, we actually see they're concentrated in the same area, right? And so then when we actually start looking at, well, all these issues are the same, and I think that our first speaker mentioned this just talks about the conditions. It doesn't necessarily tell you why. And some of the why is based on the systemic racism that we're having to deal with on a daily basis. And so we have to start thinking differently and putting all the pieces together to see the issues. And lastly, what about COVID-19? So one of the things that you see here, and you may not see this enough, is these are COVID-19 case rates per 100,000 by census tract. And so this is Cuyahoga County. The way you look at this is those areas that the darker the hue of brown, the more COVID-19 cases that we have. And this is all cases as of February 12th. Look at, even on the east side, where we see the largest or the highest rates of COVID-19. Even though we have it all over the county, we see some familiar patterns. When we begin to start putting that, and then when we say, let's figure out where the top 40% of highest cases are of COVID-19, we actually have a map like this. But then when we add that convergence piece, where those folks are have all those different chronic diseases, they're in the same place. So as I'm going to stop sharing, a couple of things come to mind. That we have to begin to start thinking very differently about the fact that we're going to have these disparities, but not only are there disparities in equity, there are inequities because they are unfair. There is nothing natural about this. There is nothing natural about people within a city having all these serious health conditions at the same time at their worst levels. And by the way, when I did this analysis for other cities in Ohio, the same pattern persists. So we have so many problems. So I'm going to stop here, give my other colleagues an opportunity to share. But this situation that Dr. Williams first mentioned is much more expansive than many of us ever realized. Thank you.
Thanks, Chip. It's startling and it makes sense at the same time, right? It's surprising and then it's like, really, how long are we going to let this go on? And the process starts at birth, or it actually starts before birth, doesn't it? So I would like to ask Dr. Rice, how has the pandemic impacted prenatal care and the whole birthing process?
Thank you, Dr. Hall, for your question. It's a privilege and an honor to be on this panel today with all of you. I would like to start by saying that what we have recognized through our COVID-19 study that we're doing in collaboration with Birthing Beautiful Communities is that there are variations between one hospital system and another regarding who is allowed to be considered as a support for the mother, and they are only able to bring one support system with them. So first, you see mothers feeling like their options are limited because the hospital has put things in place that they may not feel that they can negotiate or move around. And then there's a choice of who you would like to be there as your support system. So a lot of doulas very early on were not considered essential workers that needed to be present and as part of the delivery team, but were seen as a support. So mothers had to choose whether they wanted their doula to be present or whether they would want the father or some other family member to be there. Although we know that doulas help tremendously with social support, decreasing the risk for a C-section, mothers are less likely to need pain medication, and also being able to describe their birthing process in a more positive manner. When they're not considered as essential workers, it puts mothers in risk for more stress and more anxiety because now they're having to make choices that traditionally they wouldn't have to make. This also extends to the perinatal appointments. So some women have described that the doula is present on the phone. So then you're hoping that your technology is working effectively, that there's no connection issues, and that they're able to hear the healthcare provider. We have noticed from some of the work that Dr. Collins has done is that doulas actually work as really effective communicators. They're able to kind of mitigate and explain some of these things to the mothers and give them more information that might be lost during translation in more medical jargon. So if they're not present, or if they're not able to really be a part of that appointment, then what does that do? What impacts do we see? A lot of the mothers that I've done the interviews with, they express a lot of anxiety, a lot of worry, and just having this sense of not knowing what to expect, maybe wanting to opt to a different type of delivery. So we have seen home births increasing. We've seen mothers just choosing different providers that maybe that hospital allows more support networks. Maybe they have a longer visitor time because we've also seen visitation decrease. Mothers concerned about testing positive and hearing through social media that their babies were taken from them or kept from them. So you hear a lot of this just worry and concern. Even some of the mothers we've interviewed that are currently pregnant have expressed they're already being told that they can't have people present, but they may not be delivering until June or July. So I believe that already giving them that sense of worry and concern when we're not really sure where the pandemic will be in a few months just adds to the stress that we can't see, particularly with African American women. We know that that toxic stress results in preterm delivery, and looking at that data that Mr. Allen's presented, that is the thing that we're trying to reduce, the incidence of those preterm births and the complications that associate that.
Thank you, Dr. Rice. And that, I remember hearing about doulas the first time, and I'm like, "What is a doula?" So I've got you explained it in there that they're really the support system, and in some ways they're almost like the translator. If you have someone who doesn't speak medical, right?
Right.
The doula kind of takes what they're saying and tells the patient, what the situation is, and they've come a long way with them, right? They're assigned to them early in the process and sort of almost like a partner in their pregnancy. And
Absolutely.
so, and to not be able to go in the hospital at the part, this is the culmination of what we've been working on all this time. And now I can't go to the hospital, or you can't go to the hospital with me. The patient's thinking that's a big deal. So Dr. Collins, what's your take on this? And how has, the navigating the social support and all these other services in the hospital, how's that been impacted?
Yeah, so I have a perspective of both, doing the work with Dr. Rice and having worked with Birthing Beautiful communities for a number of years. And, we're writing up information on, what do doulas do? How do they play a critical role in social support for women? And to just expand a little bit on what Dr. Rice was talking about, both we've seen that the doulas can translate both ways, right? Mm-hmm. If the physician or any nurse, doctor, whoever, healthcare provider is speaking to the client and, they're stressed, again, Dr. Williams talked about uncertainty and fear and the social isolation. That connection, I think, is so, so important. You know, if you're feeling that in a medical appointment, you're not going to remember what's being said, even if you can understand the jargon that might be thrown at you that I think medical providers don't always know that they're not being understood.
Mhm.
So it goes both ways. What we heard from clients was that they felt seen and heard when their doula was with them. What in our new interviews under COVID, we are seeing that the opposite is also true when they're not able to be with them, that feeling of being seen and heard is less, right? So in some interviews that Dr. Rice has conducted, you know, they have shared that sometimes the medical providers do not want, you know, the doula there on FaceTime. They like turn it off, you know, they don't want to be recorded or heard. So that kind of isolation, that further isolates clients in that way. And so I think that's really challenging. So as a social work professor too, I'm sort of seeing, you know, what our students are experiencing out in the field, you know, some of the limitations that they're finding and these challenges. I do want to say that, you know, it's definitely been a need. Yeah, everyone, obviously, what's the pivoting? We've talked about pivoting and being flexible during this time and how important that has been, and how creative everyone has had to be to find solutions and try to connect with our students, with our patients, with clients, and so on. And the doulas also have had to do that, right? So they'll do things like meet the clients in a park or something with masks on, you know, to be able to make the connections, not maybe home visits like they used to. And another piece is transportation. I think that is really key. Doulas will sometimes pick up clients, take them to appointments, get them, you know, they provide Uber rides a lot of times to get clients places. You know, this kind of stuff is not yet as safe, you know, considered as safe as it used to be. So how do you get people places? You know, this is an important piece as well. And there's a lot of social support and social connections that go along with accompanying someone someplace, right? You're talking things through, you're helping them prepare for an appointment, helping them figure out how they're going to make these connections. So there's a lot of that does get removed. So they have to do a lot more planning on the front side to get folks ready. I will say that we have seen a little bit, you know, I think what some of the other speakers have talked about is about layering, right? This layering of issues, even like literally the layering of the maps on each other to see where these issues are happening. But the layering of the impacts, the social isolation, there's no question. Social isolation, I mean, true for all of us, but especially true when you're layering, you know, you have clients who are dealing with so many different issues. But we have seen in our interviews a little bit of silver linings here and there, where for some people it's a relief not to have to go to all these places, you know. I think there's no question overall it's bad, but it's been interesting. I think many of us have heard stories about kids who do better on online school, right? And then there's kids who cannot deal. So I think it would be very interesting to investigate that bit a little bit more. You know, for whom has this been a little bit of a silver lining in some ways? Why? How does that work? I think we have a lot more work to do to fully understand differences in how people have responded to it. So that's just a little bit of what I was thinking about.
And I think I've seen that amongst my patients. So my introvert patients are okay with all this. And they're finally getting to the point where they're admitting it to other people. But there are people who don't go anywhere and they feel funny about being home all the time. But now that everyone has to do it and no one can come over, they're happy about it, right? And so it's not all bad all the way around. For the extroverts like myself, I can't wait for this to be over. You mentioned a little bit about social interactions and dynamics. Have you heard about any trends as it relates to violence or social aggressions or anything within relationships, sort of being home with your partners and being home with your family? Is there any trends as it relates to that?
I think for sure there is a lot of emphasis on the domestic violence and child abuse, and a lot of concern about that. I don't think our data are there yet to fully inform us on what exactly has happened with that. But the WHO has, declared this a shadow pandemic. That this is happening internationally. When you put people, we want home to be safe, right? But home is not a safe place for everyone. And, there's, again, anecdotally, some people are fine with the people they live with. Some people are like, my kids are driving me crazy, or my partner's driving me crazy. I can't be around them, so much. But, for how families and relationships that are really dysfunctional in terms of abuse, it's even worse, right? And we don't have there's a lot of creativity that's needed to really address these issues. Because if you're with someone, a lot of what we have relied on is that we have, medical providers that are screening, right? They're doing some simple screenings. Do you feel safe at home, and so on. We have, educational professionals that are seeing children. We have pediatricians that are seeing children. We have all these folks that we have put as frontline folks for identifying child abuse and domestic violence, interpersonal violence issues. And if we're not sending our kids to the pediatrician because we're afraid they're going to get COVID there, we're delaying appointments, we're not going for things that might be regular checkups, we don't have those opportunities to identify what's going on at home and to be able to intervene there. So it really presents so many challenges for these folks. Again, back to the social isolation, not just for introverts and extroverts, but for really severe cases. I've read some interesting information about how do we get creative about that? You have a telehealth visit, how do you have like a symbol or a phrase that could tip off a provider? That makes a lot of assumptions that, the person recognizes they're a quote unquote victim, is, aware that what's going on for them is abnormal. I mean, there's a lot of things where people don't necessarily put themselves in a category where like, I'm having a problem and I need help. That often happens very far down the line when things are really, really bad. But I think that's some creative ways of thinking about how to do that. How do you get that information to folks? How do you teach them about like deleting your browser history if you're trying to find a shelter, and then the other piece is like shelters are less available, they're not having congregate facilities, they're trying to figure out creative ways to get people into safe spaces. And how do we serve these folks that are socially isolated and, experiencing pandemic on pandemic kinds of things.
Right. We really need to try to shift because how we do things. We're doing more telemedicine. We're sort of doing so many things differently, and we haven't figured out how to do it efficiently yet. And so what do you think? And this is open to really almost everyone now. And also I to the audience, I mean, if there's any questions, please, you can put them in the chat or send them in the Q&A, and I'll try to get to them because this is for you as well. Maybe it's an obvious answer, but are health disparities going to be worse because of the COVID-19 pandemic?
Yeah, I'll take a stab at that. I think so. I don't think that we've actually even seen the aftermath of what health disparities and inequities are going to look like. So I think that we have to be able to not only address what we're dealing with now in terms of the pandemic and providing information to community members that allow them to make really informed decisions that are in the best interest of their health. But I think we have to also prepare communities to really be thinking about what will the world look like when we do have herd immunity. I think that we will find that many of these health disparities and health inequities have been exacerbated. And so what we were trying to do to really rid ourselves from disparities and inequities, we're going to actually have to do more now because the pandemic will have a synergistic effect on all of these things that we're dealing with. And just one thing about the telehealth as a intervention, I think that's wonderful, but it also supposes a privilege. It means that people have some type of telecommunication device in order to do that, that they have health care in order to do that, and that the information that they're getting, even in that setting, presupposes a certain level of health literacy that may or may not be there.
Chip, follow up on that, and this is a question that came from the audience. What one policy initiative would you suggest to address health disparities?
Increasing minimum wage and providing members in the community who are below the poverty level a living wage and access to sustainable health care and also better living conditions. If we could actually even just increase access to income so that members of the communities can have a living wage and also access to healthcare, will be one policy initiative.
All right, Dr. Williams, I come to you. Is what, not a policy because you're a doctor like myself, but what one thing would you suggest that we could do that would impact health disparities?
So, Dr. Hall, I'm going to cheat and say I'd like to give two. So the first is, and I, you know, in being a physician, we always talk about evidence-based medicine, and what does the literature or the data or the evidence tell us? And so one of the things that I would definitely advocate for is something that has been borne out in the literature. Johns Hopkins University has done this study in terms of relocation, being able to move people out of neighborhoods that are poverty stricken, being able to put children in better school systems or zones, getting people out of certain housing situations that are really disparate. And so what they found is when you move these children out of that type of housing, you decrease allergens, you improve ventilation, you decrease violence, and children do better in terms of going to school, in terms of less asthma attacks. I'm a pulmonary specialist, less asthma attacks, less hospitalizations. And so I would advocate for changes and practices in terms of housing. My second would be education. So it's no secret, and Dr. Hall, you and I both know that you and I, as people of color, have benefited from being able to move up in terms of socioeconomic status through education. And the literature here again, and I'll use my background in pulmonary, and something as sort of no-brainer, smoking, is very much tied to your socioeconomic status. So the higher your social economic status, the less likely you are to be a smoker. And we all know that cigarette smoking is the leading cause of preventable death and disease in this country. The other thing is the higher your socioeconomic status, if you are a smoker, the more likely you are to quit. So moving up the ladder in terms of socioeconomic status through education and moving people out of an environment where the housing is poverty stricken would be two policies. And I'll tell you one more thing in terms of what does the evidence show. The evidence shows that historically, it has been the racist practice and policy that has designated where people live and where people can move to. And therefore, those neighborhoods that were deemed as undesirable neighborhoods, the property values aren't good. People can't get loans or mortgages to improve their housing. And those are the places where we have other diseases and situations that lead to poor outcomes, like lead poisoning. So children, Black children, have twice the levels of lead than white children, okay? And this is in older, poorly kept housing. We know that those neighborhoods where the property values aren't good and land is cheap is where we have environmental disparity, right? So this is where we have toxic dumps and wastelands, right? Where we deposit all of our environmental waste. So that in and of itself leads to another disparity in terms of things like cancer rates, right? And so we know that it's in communities of color where we see a lot of toxic dumping and waste being put. And that's again because we've decided that these neighborhoods are not desirable neighborhoods and the property value is not good. So we'll just put all the waste there. And that too leads to health problems.
Right, I see. And that increased lead can lead to increased violence and increased mental illness. And so looking at the mental illness, dealing with mental illness during this, I mean, from low grade depression and anxiety, like you talked about earlier, to just it exacerbating, serious mental illnesses. I'd like to ask, Dr. Rice or Dr. Collins, what's being done? Is there any shifting going on in terms of mental health delivery right now?
Well, I would like to say that one thing I've noticed is that we are moving mental health more to the platform of telemedicine, which personally as a provider, it was challenging when I first began working with patients because I work with children and their attention and focus on those types of systems caused my ability to, diagnose them appropriately. It was very, it was shifted. I wasn't able to do the same type of assessment. A lot of my families, as Mr. Allen said, did not have the ability to have really good technology, or the camera quality wasn't very good. So it caused a lot of my things that I'm looking for and sensing to be able to appropriately diagnose and provide medication that may be some type of assistance. It made it very difficult. I'm also very used to having the social worker present or the counselor present. And in these types of situations, some of them had to either go to the home and provide the phone access because the family didn't have a phone with a camera, or they're constantly shifting and moving the camera around. So it's making overall the type of appointment that you're accustomed to having, it's adding all of these complexities. And then as a provider, you're moving with the time. So you're just trying to do the best that you can in that situation. So I'm very concerned as things begin to come back to some new sense of normal. What will we see in terms of more anxiety, more stress, how people feel getting back into this normal life that they want to live, but still having these challenges present with being able to live that way. And also, we already were working with a system that had very limited providers. We do not have enough providers that are able to accurately and appropriately assess and be able to provide the services. So if we have more people who are trying to access and we don't have the providers present to offer those services, then that also is going to lead to more prevalence of conditions that could be managed and could be effectively treated. I'm also very concerned in terms of, we were speaking about policy, how we will see the doula in terms of the medical team. There needs to be policy that is put in place that allows them to be seen and recognized as an essential worker. I know the state of New York was able to pass that into legislation so that there is not concerns moving forward if there's any type of variant of this virus and we have concerns of having to get back to isolating people again and limiting. We don't want that role to be affected, especially if we know that they help with mental health. They help decrease concerns related to anxiety and postpartum depression, which we know affect African-American women disproportionately.
Right. And, you know, that you mentioned not having enough providers. And I know my patients will frequently want a same sex or a same race psychiatrist or psychologist, because they're talking about very touchy topics, right? And I don't know of any, right? You know, they're not. You know, we need a way to try to figure out where they are and increase the pipeline so we can have enough providers, because that, with the providers, increased providers of color, we get the cultural competency learning curve is much better, right? You know how it is to live in the city or live to be Black, and so you don't have to sort of do that as it goes. So how do we get more communities of color into the healthcare field, especially physicians and psychologists and, you know, and therapists and things of that nature? Anyone can answer.
Well, no, I'll start. I think that first of all, we need to be able to enact programs like, you know, some of the ones y'all have at Cleveland State University in order to bring more diversity into the health fields. And so I know that even my family members, I think that one of my nieces was a first generation college person. She was a student of Dr. Rice's. So, you know, and so I think that there are programs that we know that work. But I also think that part of what we have to do is, in addition to providing ways to even finance education, because a lot of folks who even want to go into the helping professions can't afford it, or they're saddled with so much debt that it's hard for them to even get out of poverty with a degree.
Right.
But the other piece to that is not just in terms of the health professions, but we need just to get more people in all aspects of life. A lot of what happens, even in terms of these social determinants, we don't talk enough about the political determinants of health. So politics really trump sometimes a lot of social determinants. We need more people in banking. We need more people in city planning. We need to be, because the health issues are even, you know, what we talk about, the wonderful work that the doulas are doing. We have to be able to expand opportunities for all the folks who want to do this work to actually have a chance to do it. And we also need to provide opportunities for people who are not folks of color to be able to learn not only cultural competency, but cultural humility, and for them to be able to become allies to be able to solve some of these issues.
Right. And I know it's difficult, right, across different populations, right, and to be able to know what you know and know what you don't know, and then be able to listen and learn a little bit. And so that's really important. We wanted to yeah, go ahead.
Yeah, I would just add that I think that I've been listening to what's sort of going on in sort of educational settings, and some of the conversations that we're having in social work are like, what about our field is founded in white supremacy, right? And how do we peel that apart and figure out where our roots were? And which is, you know, for some people, social work is sort of, you know, very open-minded and, you know, kind of liberal and blah, blah, blah. It's not like hard sciences, you know, really, you know, founded in really positivistic, you know, epistemology necessarily, because we're more touchy-feely, right? But still, we have some roots that are based on white values and white this and white that, and so, and white people created it and, you know, expanded it and whatever. And a lot of the voices of Black and Brown people have been left out of the history of this and many other fields. I don't think just social work is that. So what voices have been allowed to rise up? How have we created our fields to exclude or include people? I think we really need to look at our educational delivery, our systems, our biases, just super deeply, and go in and just really reconstruct, if we can, and figure out where we want to be, and how do we get away? How do we apply explicitly anti-racist frameworks to our educational system. Because I think if we continue to perpetuate injustices in our teaching, in our curricula, we're not going to move very much. Just trying to recruit people isn't enough. We have to change the way we do things. If our tests, our licensure exams, and continue to show us that certain people do not get certain scores, then we have problems and we have to fix them. We have questions about that in social work. Who's passing the licensure exam? Why do things look as they do? And so I just think we just have a lot of work to do in figuring out how we disassemble, what we have and do things differently.
Right, and that's the case across, when you think about increasing the number of communities of color in medicine and nursing and all that, and PhDs even, it's, all of those standardized tests are discriminatory, right? They're designed to be discriminatory, and they are discriminatory. And so we are, with all this math, they are getting exactly what they want with those exams. They're getting exactly what they want, and through mathematics, right, and statistics. And so it could be changed if they wanted to. So I know a number of people, we're in the point now, Dr. Williams and I are on the Board of Health. We've had a lot of discussions about the vaccine coming out. And I know there's a number of people in the audience that we probably are skewing younger, that haven't had access to the vaccine yet, and maybe haven't decided whether they want it or not want it. So I wanted to do a little bit of discussion about the vaccine, and what are they saying to pregnant women about taking the vaccine?
Well, when I look into the literature regarding the vaccines, particularly for pregnant moms, you don't really see a consistent message. In some literature, you see that there is support of taking it, and that there's no evidence that it has any risk for the mother or the baby. And then in others, they're saying that we don't have enough information or data to be able to know that risk. So what I see when we're interviewing and speaking to these mothers, a lot of them are aware of just how our medical system hasn't always been completely open and transparent related to vaccinations, going back to the Tuskegee experiment and things of that sort. So we have a community of people who already do not trust these solutions, different tools that we use to help kind of mitigate the virus. We also see that a lot of people are using social media to get their information and their facts and data. So when you're relying on these measures as your information, sometimes you can get things that are just not true, misconstrued, things of that sort. So we're also dealing with that. And then in addition to that, that ongoing just fear of how quickly it came out. And I've heard rumors of it changes your DNA and different things like that, because people are also very accustomed to a vaccine being created in your, similar to like a flu vaccine. So hearing this different type of way, and then having different options, and then not knowing how long you will have this immunity and things of that sort, you add all that in, and then on top of that, being pregnant, there definitely is some caution, which understandably, why wouldn't you have some caution? You want to do what's best for yourself and for your baby, but you also want to make sure that you have all the information you need to make an informed decision. So I have not seen a consistent message. So far with the mothers that I have interviewed, they have not taken the vaccine. The majority of them have just isolated themselves or protected themselves via the other measures such as mask and hand washing and things of that sort.
Right. So, and I see that in my practice, that when people ask me, well, why are African Americans running away from the coronavirus vaccine? And that's like, well, they run away from all vaccines. Every fall, I got to argue with everybody about the flu vaccine, the pneumonia vaccine, the shingles vaccine. And data shows that African Americans tend to be the least accepting of vaccines in general. So then you throw together a vaccine like the coronavirus, you know what I'm saying, from their perspective, then absolutely not. I'm not taking that vaccine. Now, thankfully, the trends are improving. It's shown that when people know people that have had the vaccine, they tend to be more accepting. And so as you know more people with the vaccine, you're more, and you see that they do okay, you're going to be accepting of it. I know healthcare workers, I was in the wave of people who had access to it first. And so a lot of people, that at the nursing home that may have worked in the kitchen or nurse's aides or something, they passed on it. And now they're asking me, Dr. Hall, I think I want to get it now that I haven't died from getting the vaccine. Now that they're thinking about doing it. So we see that changing, but it's still that basic issue of trust and not having trust in the healthcare system, in a healthcare system that has not earned your trust, right? And so those are sort of the dynamics. But I'd like to hear what anyone else has to say as related to the vaccine.
Well, I had an opportunity to participate on a vaccine call for, it was a webinar, something like this. And one of the questions to all the panelists, and I think this was a litmus test for our legitimacy, was to see, the question was, would you take the vaccine if it was offered to you? And every one of the panelists answered. Most of us said that we would. One honestly said, I'm going to wait and see. But the reason why I thought that was such a good question is because I think it reflected where people are in terms of this issue. And I know that in terms of the state health department, we have, there is a plan in terms of vaccine strategy. And there have been a number of different community members who have come out and say, well, we can appreciate the complexity of trying to, vaccinate so many millions of people in Ohio. We still have concerns. And I think that one of the things that we don't do enough is a lot of times we try to sell the benefits of the vaccine, but we don't necessarily take time to listen to what people's real concerns are. Mm-hmm. And I think I heard Dr. Fauci say it best when he said, before we can even get into the effectiveness of the vaccine and why people should take it, particularly our Black brothers and sisters, our Black and brown brothers and sisters, we have to really unpack why they don't want to do it or get it in the first place. And I said, until we do that, we're not going to get the level of vaccination needed to protect everyone, because we haven't really dealt with issues of mistrust and issues that are going on in people's lives of why they still mistrust the system.
Mm-hmm. Right. No, I think you're right. And that's one of the issues. They were wondering, how can Black and brown consumers be more informed self-advocates when dealing with the medical system? Like, so, how kind of even the disparity between, how you see the provider is high and I'm low and I can't ask you questions. Like, how do we try to bring that more into balance? Anyone?
Well, I think that's one of the challenges, because one of the things that we have heard is actually a couple of things. Number one, we tend to trust people that we know and people that look like us, right? So I have patients that I say to them, but in the studies that they did, they had African American patients, they had Hispanic and Latinx people in the vaccine trials. And my patient will say to me, yeah, but I don't know those people, Dr. Williams, I know you. And I'm like, okay, you have a point. I got vaccinated. I did it very publicly, and I'm actually a relatively private person. And so I think it's about people that are trusted in the communities being visible and sort of coming out of the ivory tower. So I know for myself, I have to come out of the medical center, out of the hospital, and into the communities, right? So I have to be at sites where people are being vaccinated. I have to be on panels like this. I have to be at places where I can meet people where they are, because equity is about removing barriers. And the way to remove barriers is to meet people where they are and to really find out what are the barriers. And you can't do that if you say to people, well, just come to where I am and we'll get it fixed. That's the wrong approach. So I think one of the things that we know is that knowledge is power, from the standpoint of understanding that there are, because of the atrocities that happened with the Tuskegee trial and other things historically, there are now committees and boards that are put in place to ensure those kinds of atrocities don't happen again. Understand that now there are people, people of color, who are in position to oversee what happens in vaccine trials. Many people don't realize that the Moderna vaccine is actually built upon the research of a young Black woman who Dr. Corbett, in her years as a immunologist, a PhD research scientist, it's her research through the years that the vaccine is built upon. So this is a woman of color, and she has given talks on how we were able to so rapidly come up with this vaccine. And so how do we get that knowledge out into the community to understand that here's the woman who is basically the brains behind the vaccine? I think the point about pregnancy and vaccination, mixed messaging leads to mistrust. It leads to confusion. Where there are holes in information, people fill it in with misinformation. And certainly in the age of social media, we see a lot of misinformation. And so here again, I think it's incumbent upon us who are people that understand and believe in the science and the evidence-based medicine to really get out there and meet people where they are and try and remove these barriers. And we have to get out there and do it in what I call plain English, right? So I can't go and talk to you like I'm talking to my residents and medical students at the hospital. That doesn't work. That doesn't work. And so it's about meeting people and being able to communicate such that they can understand and such that they feel comfortable asking questions, and not being made to feel like, oh, well, that wasn't very smart, or that was a dumb question. No, I want you to ask me because I want you to understand. And if I haven't explained it such that you can understand, then I haven't done my job.
That's right. That's right. And then that's so true. And one of the dynamics of being in a pandemic where we with this new virus, right, is that we're figuring this out in real time. And people don't appreciate the fact that we're figuring it out in real time. And so it makes us look like we don't know what we're doing. In reality, we're doing really what we do with a whole lot of things, with hypertension, with heart disease. I tell the residents, what we do with congestive heart failure, people with congestive heart failure, what we do now would have been malpractice when I was in residency, right? And so it's like what was right was wrong, and what's wrong is right. And all of medicine is like that, right? But it's because of the pandemic, we're just being exposed for how we actually really do everything. We kind of look at it and it's like, well, what's the answer? We still haven't said what our answer is about, do we recommend pregnant women get it or not? And our answer is it's not easy to answer. Well, were there pregnant women in the trials? Generally, no, right? So who's gonna be the first, to sort of do that? And so we're not being coy by not answering. We're not answering because it's a hard question to answer. And then what they do, they say, well, talk to your provider, right? And then they come to me and I still don't know, right? So it's like, it's a difficult situation. So one person said, truth and reconciliation, is that a strategy to addressing the mistrust? I mean, the mistrust runs deep, right? And I think people appreciate when they see providers that are truthful with them. If I try to be truthful with them and say, I don't know this, or I don't know that, or we were wrong about this or that, and people tend to appreciate that. But unfortunately, there's a lot of doctors out there that put on this air that they know everything, or that they want to give you the impression, rather than say, I don't know, they say, I'm not sure, which is one of my my pet peeves. Do you know? I'm not sure. Well, you're really not sure. You don't know. Being not sure is you've got two options in your head. If you have nothing in your head, you don't know. So is truth, and the truth, I think we're doing, like Dr. Williams was saying, a better job of giving the truth, right? And we're in rooms where some of these decisions are being made. Dr. Williams and I are on the Cuyahoga County Board of Health, and we're overseeing in a way the distribution of the vaccines in Northeast Ohio. We're trying to make sure it's equitable, and we're trying to make sure it's efficient and it doesn't leave people behind. But again, that's not sort of widely known, sort of as well. But the reconciliation part, help me out with what could we do with as far as reconciliation?
Dr. Hall, can I just go back to one thing about the whole relationship between the patient and medical provider? Just something that needs to be said is that I know when I was growing up, we were socialized to think that healthcare providers knew all. And so they told you what to do. And now we have come to the realization that the healthcare provider is a partner in health. And so, for example, if I have high blood pressure and you prescribe a medicine to me that my friends told me is not good for Black people, do I sit back and say, well, because the doctor said it, I have to take it? Or do we really work in partnership to do what is necessary so that we can be partners in my health, so that I control my health and you a partner to be able to facilitate that, as opposed to little me, big you, being, the physician. And so I think that part of what we have to do is to be able to tell our families and communities that the healthcare provider they go to is a partner in health. But they have to be, if you're a man or a woman, if you want to have control of your reproductive rights, what have you, we have to let folks understand that it is their right to be able to determine how they want to get treated. And the healthcare provider is a partner, not an overseer. And I think that is something that is slowly taking shape, but I think that we have to let more people know that they have to be in control of their health. If the physician is not saying something, or the nurse practitioner, whoever, is telling you something that you don't think is in the best interest, it is their right to question, to ask questions, and if they don't like what they hear, to ask for what is an alternative. And that's what I don't hear a lot happening.
That's right. And we've got Arthur James in the audience, who is a legend in terms of this, and he's got an answer in terms of the vaccination. So I'll just read it. He says, regarding the vaccine on pregnant and breastfeeding women, the trials are just beginning. The studies are just beginning. In the interim, until those studies are done, the American College of Obstetrics and Gynecology has suggested that given the deleterious outcomes for pregnant women who get the virus, that the vaccine should not be withheld from pregnant and breastfeeding women. The current recommendation indicates that women should discuss their risks with their providers, and particularly for women at increased risk for acquiring the disease, people in the front line, essential workers, medical workers, et cetera, should strongly consider getting the vaccine. So he says this is not a dodge, it's an admission that the studies have not been completed in pregnant women, and until all the science is in, this is what our best recommendation is. And it sounds sensible, and thank you, Dr. James, for sending that in. Any comments from Dr. Rice or Dr. Collins?
I was just going to add on to what some other folks were saying, what Dr. Williams was talking about the importance of trust. I think Dr. Rice has touched on, the doulas and how important they have played as a trusted source of information. Even when they did not trust their physicians or other providers, they trusted their doula to interpret the information and help them contextualize that information in their own case, because the doula knew them more intimately. I would just say I have seen this extended in other work that I've done on very vulnerable populations, in particular housing unstable families. very, very poor, very stigmatized. Also, many of them involved in the child welfare system. So they have like multiple system involvements. They too, have difficulty trusting, and having an advocate, someone that is sort of on their side when society feels like it's not on their side, and people are trying to keep them down. Having an advocate of some sort. So not just, we see it in the doula situation in particular, but I've really seen it expanded in my other work. This is true in domestic violence as well.
Mhm.
Having someone who knows what they're talking about
Mhm.
and knows you, I think is really important. Those two pieces, it decreases your uncertainty, which Dr. Williams, pointed out is related to the fear and anxiety that we have over all of this. So it reduces your uncertainty. You have trust. You have someone who knows the system and can help you navigate it. So I think patient navigators, they're very used in a much more specific kind of way. I think this is much more broad and more intense and intimate of an idea. You know me, you know my family, you know our situation. You're helping me address all the social determinants, not just my health problems, right? You're helping me figure out my mental health, maybe my substance abuse, my legal problems, and there's one person. It's not 50 people that we've referred you out to. It's one person that can help, these soft handoffs, and also, help you understand and contextualize. They can help you figure out how to enroll your kid in school, how to take the bus to get to the child welfare office, you guys have talked about all these social determinants, but I really have seen that there's, this one person that can be that connection between a human and the systems, can be so important for building that trust and addressing a lot of these issues, figuring out, the vaccine's okay, and I know because blah, 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 and I know you and it can work for you.
And that makes perfect sense. But I wonder, we've got thousands of healthcare practitioners that are in position, right? I've been practicing over 25 years. And so how are you going to change my biases, right? I mean, we're basically adding an extra person because me as a practitioner, I'm not able to communicate effectively. As Dr. Williams said, it's my fault really that I need a doula, and we need 5 people in the room in order for us to have a productive relationship. And so how do we impact the biases that are in the providers that are already in place?
So as a clinician educator, I oftentimes talk to my trainees and say, I'm encouraging you to be a lifelong learner.
Mm-hmm.
And I too have been in practice for over 25 years in medicine, and I'm consistently learning new things, both clinically and also as it relates to patient interaction and patient care. And it's about, are you really serious and committed to doing what's right and what's best for your patient? Because if you are, then you will do the things to help improve the trust that your patients have, the relationship in terms of what Chip was saying in terms of being a partner, right? So you want to be a good partner. And what things go into being a good partner? One is a partner that can be trusted, and 2 is a partner that communicates well with you. And so it's incumbent upon us as people in the healthcare fields, be it nursing, social work, pharmacy, respiratory care, to do the things that improve our communication skills, that improve our understanding of differences in culture and ethnicity and race, do the things that keep us informed and up to date, right? So things that we learned clinically, as Dr. Hall has pointed out, learned clinically in medicine 20 years ago have changed. and our understanding in terms of interactions with patients has changed. When I was in training, we did not have the internet and social media telling patients one set of things versus what I, as the provider, I'm not trying to dispel or debunk certain things that you've read on the internet that clearly have no roots in science whatsoever. And so I think it becomes important for us to be lifelong learners, for those of us who are established in healthcare, and not lifelong learners solely on the clinical practice, but lifelong learners on things that pertain to health. And one of the things we know is that health is only 20% the clinical things. Health is the social determinants of health too. And how do we educate ourselves on that? Like I said, in learners, we have a whole generation of new residents, students coming out of medical school and all sorts of schools, pharmacy, respiratory care. And so those trainees have to have as part of their curriculum these very topics, because otherwise going forward, we're going to keep repeating the same cycles of having patients that don't feel like they have good partners in us as healthcare providers, who don't feel like we adequately communicate with them, and therefore can't be trusted.
Right. But we're also working in silos, I think, in a way that, there are a lot of people that believe, if Black people would do right, if they would eat right, if they would stop smoking, if they would, do right, their health would be better. And I can't help that. Some people, providers, really might really say that. And so it's just, they throw their hands up. I'll tell you something once, you need to take your blood pressure medicine. And I don't know how many times I need to tell you that. And they're not fully understanding the trust. When I speak about the Tuskegee incident and grave robbers and all that stuff, they don't know anything about that. Many of them think it's fake news. I'm just making it up. There's nothing to that. And that's sort of taken off over the last 4 years. And so they're in this column that says they're hopeless. They don't know to take the vaccine, and yet they're dying of I can't do anything with that. And then we're saying, we need you to start to listen more. We need you to educate yourself more. And they don't believe they need to be educated more. They think they know everything that they need to know. And so how do we bridge that? And how do people in the community try to figure out a way to bridge those two silos of people who they won't admit that that's what they think, because it's inappropriate to admit that, but that's what they think. I know that's what they think, and I know what we're thinking, and we're sort of, they keep saying the same thing. We keep saying the same thing. How do we move the needle?
Dr. Hart, one of the things I think, and this is just a tactic, this is not an overall strategy. For those healthcare providers that don't want to listen to the science, a lot of industries are going to pay for performance. So they're looking and saying, well, in order for you to be able to get, a bigger reimbursement, then you need to be able to improve your health outcomes. And that is one of the things that I found that helps healthcare providers say, well, how can you tell me to eat right when I live in a food desert?
Right.
How can you tell me to be able to increase my physical activity when I have to maybe go into neighborhoods that are unsafe? So I think that part of it is that, and as Dr. Williams said, you have to be lifelong learners, but I think that the systems are beginning to understand that 20% of health is only, received in a physician's office. So or healthcare provider's office. So how do you begin to start to be able to have certain types of incentives that allow them to understand that if you want to actually be able to grow and be more profitable and be more successful in the practice, you have to start to understand what is actually driving the health for the people who come into your office. And I don't think that many healthcare providers are going to be able to get away without having to address those type of issues.
Right, and we're seeing changes in that. Any other input? So what we're gonna, yeah, go ahead, Dr. Williams.
I was going to say, I think, we have seen that money is a regulator. It is an incentive. It's a regulator, and certainly when you look at other things that we have struggled to change, we know that lack of sponsorship in terms of corporations drove change, right? And we know that there are some things that change just by who it affects, and it changes our thinking. Many times the whole thought process around substance abuse was that these are horrible people, they're bad people, they are dysfunctional, they're laggards, and that simply became a different mindset as we faced the opiate epidemic, and what was once something that was largely in the inner city was largely disadvantaged ethnic minorities, and disadvantaged, people of color, as it became, no, it's actually a lot of people that are struggling with substance abuse, and it's people that you may be going to work with every day that struggle with addiction. Then the mindset started to change from these are bad people and people that need to be punished and people who should be jailed and people who should be treated as though they are criminals, to let's have a little bit of understanding and compassion and really talk about what things have we done and put in place to try and treat what we now know is a medical problem and condition. It's an addiction. And this is a brain disorder and disease, right? And so I think that mindset does change. Mindset changes in part related to economic circumstances in terms of where's the money going or not going. And I think it also changes when it affects certain populations as compared to other populations. And unfortunately, we saw that with the opiate epidemic and huge numbers of deaths and overdose, realizing that our previous conceived notions as to who was affected and what kind of people they are changed. And now we've put more money and resources and treatment into addressing that health crisis.
Very good. Thanks, Dr. Williams. We are running out of time now, and so we're going to transition into any final thoughts that anyone has. We've had a great discussion so far.
I was just going to add to what Dr. Williams was talking about in terms of cultural change, and when we talk about culture as shared beliefs and ideas, and that does happen slowly. But I think the compassion piece is super important. Also, this increasing understanding that we all have biases and that it doesn't make you a bad person to have a bias, but that we really need to do a lot of self-examination, not labeling people, you're a racist if you think this, whatever, because that really, I think, pushes people away from this idea. And looking at diversity, so-called diversity trainings and so on, and really looking at evidence, what does change, how do we make this change in all areas of our life, and moving that cultural needle more toward recognizing, I'm hoping that the events of this past summer, have opened a lot of people's eyes where they were like, wait, what's going on? And, and that sticks. Dr. Rice and I have had this conversation, that I don't want that to be a trendy thing, that we're just BLM, hashtag BLM, we're signaling that we're on the right side, but that we're really doing harder work to try to really get under and change the cultural beliefs.
Dr. Rice, you have any parting words?
I just wanted to add, really understanding where your patients are, where your populations are, what they're struggling with, the challenges they have. I really believe that even when we have these recommendations, if there is a disconnect between what you're recommending and what your patient is feeling, then you won't be very effective in getting things done. So even when it comes to the vaccine, it being open and honest that there are some people who just do not feel comfortable or do not feel that they can trust that it has been created and distributed for their best interests. So it can be a recommendation, but if we're not able to effectively really hear the patient and really understand their concerns and recognize that there are legitimate concerns, then we will have challenges being able to get these wide things to pass. I even think about with the mask, there was a period of time, there was so much miscommunication and just inaccurate information being given out to the public. So then you're having additional things that you're constantly having to address. It would have been maybe more effective if there was a common language and amongst even providers standing on, collectively, so that people knew that everyone was moving in the same direction. But as you stated, they're watching science evolving in real time, which doesn't often happen, seeing the scientific process of testing and reevaluating and changing things. Maybe in one country it was more effective to do one treatment modality, and then when it came over to the US, things shifted and changed. And understanding that those shifts and change cause people to question your processes. So having to do maybe a little bit more education, maybe a little bit more communication about why things work this way here, why it's different here. I even remember there was a time where people didn't think that African Americans could get coronavirus because it was in areas where there weren't large percentages of African Americans, but here we are. So how do we move forward? How do we continue that dialogue? It's not going to go away. So how do we continue to keep people informed and really do a great job of hearing them, making sure that they know that the ultimate goal is to be a partnership and move forward for what's best for everyone.
Sounds good. That's a great summary. Chip Allen, from coming from Columbus, any final thoughts?
Well, just first of all, thanks for the opportunity for this great conference to be a part of this great panel. I am very concerned, but I'm encouraged. And I think that just by, the things that the panelists have said, provide a lot of insight and answers to some very deep questions. But one caution I just want to make for everyone, and that is when we start talking about issues of equity, we have to be able to have the hard conversations. We have to be able to talk about white supremacy. We have to be able to talk about the political determinants of health, those political decisions that stop us from doing what needs to be done. And the thing that I am concerned about is the fact that the whole term of equity is being appropriated in ways because issues of racism are now popular. We have Black Lives signs matters all over in people's yards, and I think that's encouraging. But we have to continue this momentum because just like we have the unfortunate murders of George Floyd and Miss Taylor, we had Emmett Till in the 1950s. And so the thing is that we have to be able to ask ourselves, how can we show that equity is a really good growth model that everybody benefits from, whether or not you're white or Black? And how do we hold politicians and agencies accountable for what they said they're going to do to increase equity for everyone? Because if we don't do that, there's going to be another pandemic and we're going to be having another conversation just like this without actually moving the needle. And I think that's something we should all remember.
And so those are excellent points. And Dr. Williams, thank you for being a part of this. Is any final thoughts?
So I think one of the things that I would encourage all of us, and when I say all of us, I mean in addition to those of us in Black and Brown communities. So to get this right, moving to a culture of anti-racism and equity, both in healthcare and so many other areas. This cannot be an issue that we as Black and Brown people are championing alone, right? It can't be that Black and Brown people are doing all of the heavy lift and work. We need everybody else because it is, in fact, our country, all of our country, and it is, in fact, all of us who want to live a life that has equal opportunity for all of us. This isn't about me and mine. This is about we and our. And so in order to move forward, we need it to not just be Black and Brown people who are talking about these issues, but others as well. And I would just, say to our majority brothers and sisters that, as uncomfortable as you may be, I would ask that you be uncomfortable, but recognize the way to get comfortable is for us to all have equity. The way for us to get comfortable is for us to not have disparity. The way for us to get comfortable is to have really justice and justice in healthcare and in so many other areas. That's how we can move forward and how we can get comfortable.
Well, thank you so much for such eloquent thoughts. Dr. Sherry Williams from the Metro Health System, Johnny Chip Allen from joining us from Columbus and fighting for health equity across the state of Ohio. Dr. Heather Rice helping us stomp out depression and illness in children across Northeast Ohio. Dr. Celeste Collins, being such a leader here at Cleveland State. I'm Dr. Greg Hall. I appreciate everyone's contributions and questions, and we hopefully will continue this dialogue and make the world a better place. Thanks so much.
Am I back? Okay, I hope I am. Wow, that was an enlightening conversation. Thank you, Dr. Hall, and all the members of that panel. There was just so much to take in, and I guess a couple things I took away is the need for a mindset change that addresses education and curriculum, that addresses trust, and the need to incentivize change. That was a very important point. I also appreciated that it's not about zip codes, but about census tracts. That was important. And finally, I think it was important to think about equity and anti-racism as the way forward. It can't simply be, we heard important points about what it is that we're dealing with right now, but equity has got to be a real concern for moving forward. Otherwise, as Chip Allen said, we're going to be back in this situation again. So wonderful panel. Thank you all. Please feel free to address whatever stood out for you. Write our panelists, write your questions, your takeaways. We especially want to hear your takeaways. Okay. Next, we have our second artistic break of the day before our final panel discussion, on racial inequalities, led by moderator Dr. Roland Anglin. This break is brought to us by Akron native Darius Simpson, who is a writer, educator, and performer, and currently resides on the West Coast. His poems have been featured in magazines such as Poetry and American Poetry Review, and he has performed on platforms including TEDx, Button Poetry, and the Huffington Post. Today, he's sharing his talent with us. Please welcome Darius Simpson.
Hello, hello. Greetings, salutations. What up, though? So I'm gonna do poems. Super excited to be here and be a part of this conversation. Just from listening to some of the things that got shared, I'm really interested in and have been interested lately in language, particularly in ways that Black folks, anybody who seeks to resist oppression, and really the limits of the language we use. And so I think when we talk about equity, when we talk about justice, what does that look like inside of capitalism? What does that look like inside of a structure that was founded on, particularly on this continent, racism, right? And so and then next to that is thinking about what does anti-racism look like, if not also anti-capitalism, if not also anti-imperialism. And then thinking about those are the things that we're seeking to undo and to unravel. And so what also does it look like if we're not really fully articulating the world that we want to see? So yeah, I've really just been sitting with that. And I think often, especially thinking about events and panels for a specific issue, we talk about the ways that we're reforming this particular area. And then the other question that comes up is what movements are we tapped into, right? And so what folks on the ground that are doing movement work, what organizers are we building with that are getting resources to people that will allow them to be able to survive, to do that transformation that's necessary. But yeah, those are just the things I'm thinking about. For this section, I'm going to share a poem on my screen. It's an audio visual media experience. It's 3 minutes long, and then I'm gonna do some live joints. But I'm gonna share my screen now. The poem is written and voiced by me, but the visuals and the music that was added was with an organization I worked with. So yeah. Shit. Then come back. COVID-19 shook the world to its core, or kicked up a familiar dust, or coughed up what's been resting in the diaphragm of the United States for centuries. Coronavirus broke headlines as a global pandemic, while 2020 was still getting its bearings. You might think, in a time of social distancing, while many of us face an issue that is incapable of discriminating, that we are finally in this together. Yet, there are communities who are more drastically impacted, even by a virus that promises nothing except that it is equally contagious regardless of skin color. Perhaps a virus need not discriminate if the humans it is infecting have created systems that do the discriminating for it. If we are advised that our safest place is inside, then what of the people without an inside? If we must distance from even family, then what of the families who live in no-bedroom apartments stacked on top of each other? If school has moved from classrooms to the kitchen table, then what of the students without kitchen tables?
I had one shift where I saw about 84 patients the first 21 days.
Maybe this virus has illuminated an age-old inequity in this country, with mortality rates 6.7 times higher for Black people, 4 times higher for Indigenous folks, 2.5 times higher for Latinx humans, and 2.6 times higher for Asian and Pacific Islanders. Perhaps now is not the time for answers, but for questions. Like, how might we even the playing field? Where are the gaps and needs? Which humans have access to which healthcare? Who can afford to work from home? Why are essential workers being called heroes but not being paid like heroes? What will happen when they are no longer considered essential? What if we acted in solidarity with our most vulnerable? What if Black and Latinx people didn't comprise 56% of the prison population? What if there was no prison to populate? What if no one was disposable and the virus couldn't recycle itself in the imaginations of the rich? And what if we just stopped for a second to consider all the sickness that existed before, to consider how we might start healing those systems, to consider the color of COVID? Word. Also realizing that it seems a lot more dramatic when taken out of the context, because the event was called The Color of COVID, and so now that ending feels much more dramatic. The color of COVID. But yeah, so I'm gonna do a couple of poems live, really thinking about, so I was talking about the limits on the language that we use, and I think another limit is our being out of practice with connecting, like right now, to the long tradition, the long trajectory of the United States. I think we talk about hope, we talk about rebuilding and all of that. And without really going back to where we started in a critical way, and like where we've actually been, in the reality that to be, just a random example, to be a president of this country, this nation, is actually to be evil. Like, it requires that of you because of what you have to participate in and what you have to be, at the very least, complicit in. But anyway, yeah, just thinking about that tradition of the United States, and like what it actually is, not what it says it is. And so yeah, I'm gonna do a poem that really just rambles about that as me thinking about it. It's called One Word Rhymes with Fascism, or Irrefutable Proof I Know the President Personally. Donald was my partner for a presentation on the civil rights movement in 3rd grade. Donald was my best friend until we reached middle school, and then Donald was the quarterback casually tossing around the N-word on the playground. Donald was born in the hatchback of a red Ford pickup truck. Donald was raised by both parents in the center of a cul-de-sac. Donald shot a protester in the face and got a promotion. Donald shot a kid in the stomach and his coworkers didn't blink. Donald mowed down a woman with his car and his criminal record didn't flinch. Donald got all his best ideas from a middle school history book. Donald's best jokes about Black people are 300 years old. Donald passed me on the sidewalk and clutched her purse like a football. Donald walked into a booth and voted for himself 73 million times. Donald voted for his opponent too. Donald started a women's movement for herself and still lost the election. Donald is allergic to the words intersection and abolition. Donald said, if you don't vote, you ain't Black. Donald built a wall around the word American and started a war to guard its border. Donald took a page from drone strike policy, which studied oil-driven bloodshed. Donald copied off of manufactured drug wars funded by Jim Crow nest eggs. Donald said if he could, he would end the Civil War without freeing the enslaved. Donald was ousted in 2015 for wearing blackface while serving at her local NAACP. Donald blends in like a mass shooter in Bible study. Donald blends in like a proud boy in blue jeans. Donald inherited clown shoes from his father. Donald perfected circus paint in business school. Donald wore a loose-fitted hand-me-down suit to his inauguration. In summer 2012, Donald was a car full of himself, speeding past me on the sidewalk, calling me outside my name. Donald was a manager at a grocery store who called me a monkey. Donald was a manager at Pizza Hut who asked me why Black boys love their mothers so much. Donald couldn't answer when I asked him why his grandparents were so good at killing mine. Donald does not think jokes about his heritage are funny. Donald laughs at the thought of not knowing where he comes from. Donald brings no original ideas to this imperialist group project. Donald might fail his mission if we stopped giving forgeries full credit. Okay, that's the first poem. Gonna do 2 more. I haven't said much about myself. Living in Oakland now. I'm from Akron, Ohio, but I live on the West Coast. My life is pretty much talking on screens. Shout out to everybody that has to teach or do meetings all day. We're surviving out here. yeah, while I'm doing poems, feel free to put things in the chat. Feel free to respond with reactions or to not, whatever you feel like. But I don't know about y'all, but I come from a call and response people. Amen. So yeah, feel free to do that. And yes, it's really dope to engage somehow. And I hope that y'all are on the other side receiving. It's really hard to tell in a virtual world, but yeah, I've been thinking about, it's wild, right? That people are dying right now. People have died and will keep dying, not because, the structure of the I guess it is the structure of the United States, not because capitalism needed to survive, because it didn't want to be interrupted too much, right? All it is so that we can keep up business as usual. It's madness to me. So I've been thinking lately and always, especially being Black, about my life after and what I might ask of people who survived me, loved ones, friends, Black folks in general. And so after Sandra Bland was murdered, there was this trend, particularly for folks in my age group, to say, if they take me, I swear I didn't do this to myself. If they take me, burn this mother down, and things like that. And so I started thinking about what does the invitation look like for the people, and like what it look like to ask the questions, because I think it isn't like, yo, do this when I pass, but it's like, are you the type of person right now that would do that? If I'm taken, are you the type of person that would show up for me? Are you the type of person that would get out in the streets, right? Because you're already that person right now. And so this is a poem that sits with that inquiry, I guess. And it starts, if I'm caught between a badge and a hard place, 3 hours after the street lights turn on, will you church it? Will you pass it along pews of almost saints until it reaches the whole congregation? Will you tithe it? Will you stretch it thin like goat skin over the shell of a djembe drum? Will you slap it? Will you let the echo dance naked in the wet cave of your throat? Will you bark it? Will you sing it like my mother is listening? Will you inhale until your lungs nearly burst, then inhale some more, then and only then will you say my name? Will you put some stank on it? Will you juke joint James Brown it? Will you Jerry Curl spray it? Now how can I rest in peace or power if you get all lazy lipped when you talking about me? Will you scoop it thick? Will you stir it slow? Will you mac and cheese it? Will you to spread the savory over your tongue? Will you let it marinate? Will you serve it with Sunday dinner? Now, if you say my name and cast iron skillets don't start to rattling, that means you ain't say it loud enough. Will you say it again? If a redwood don't split open from the trunk, that means you ain't pronounce it right. Will you say it again? Will you redecorate a city in streams of fire after me? Will you paint downtown a scorching hue? Will you stain the sky in black smoke? Will you tell ghost stories over the ashes of this empire? Will you scream it? Will you stand in the clutter of some rush hour traffic to let them know what kind of boots I wore? Will you stomp it into the soil of the last place where I laughed with my whole body? Will you dance it? Will you Saturday night praise it? Will you tambourine it? Will you drunken favorite song shout it? Will you full moon howl? Will you shriek? Will you chant? Will you live? Will you cry? Will you cry for me? Will you? Thank you. And I've got one more piece to share. I think, so really this piece, I'm super excited. It's just won a contest. And have been thinking lately how to bring my authentic voice, because I have a very Black internal voice, but I think often when I'm going into performance, I'm like, how do I communicate this in a way that will make sense? And thinking in proper sentences and language and all that. So I've been trying to bring up my natural voice back into poems, which is really just my Blackest voice, my Blackest self at all times. And as we know, we live in a society that is constantly trying to, strip that out of us. It really requires a stripping of that for participation in any sort of quote unquote professional setting or anything outside of ourselves. And so we relegate those conversations, that language for home, cell phones, text, all that. So yeah, I've been thinking about ways to disrupt my own thinking about what it means to create a poem and to have an authentic me in it. And so I'm sure y'all heard the phrase, we don't die, whatever comes after. And so this deals with that. We don't die. We second line trumpet through gridlock traffic. We home go in back of Cadillac limousines. We wake up stiff in our Sunday best. We move the sky. We escape route the stars. We moonlit conspiracy against daytime madness. We electrify. We pass due bill but full belly. We fridge empty. We pocket lint. We make ends into extensions. We multiply in case of capture. We claim cousins as protection. We extend family to belong to someone. We siblings because we gotta be. We chicken fry. We grease scout. We hog neck greens. We scrape together a recipe out of scraps. We prophesy. We told you so, even if we never told you nothing. We omniscient, except in our own business. We swallow a national anthem and spit it out sweet. Make it sound like red velvet ain't just chocolate with a little dye in it. We bend lies. We amplify. We laugh so hard it hurts. We hurt so quiet we dance. We stay fly. We float on tracks. We glide across linoleum like ice. We make it look like butter. We melt like candle wax in the warmth of Saturday night liquor sweat. We won't die. We dust that colonies couldn't settle. We saltwater city built from runaway skeletons. We organize. We Oakland in 66. We Attica in 71. We Ferguson before and after the camera crews. We won't die. We won't die. We won't die. We won't die. We won't. Thank you. That's my time. Appreciate y'all. You can, I don't know if y'all want to connect, but I'm on the internet. Just use my first and last name. Appreciate y'all for inviting me, having me here. All power to the people. Let's get involved in some movements, disrupting this oppressive society that we're caught up in right now.
Ready to go?
You're all set to go, Dr. Anglin.
Thank you. Indeed, a powerful message to follow. Good afternoon. My name is Roland Anglin, and I'm Dean of the Maxine Goodman Levin College of Urban Affairs here at Cleveland State. I'm very honored to be part of this important conversation. This panel is entitled Racial Inequities in the COVID-19 Era. You know, to start this panel, we have to acknowledge that the tragic losses of Ahmaud Arbery, George Floyd, Breonna Taylor, and many others have illuminated historic and contemporary racial biases in the United States. So too, the disparate impact of COVID-19 on Black and Brown people have added fire to this long-lasting fire of bias and inequality. Today's panelists will present their perspectives on 4 areas where disparities have long existed and what they have observed in the middle of this pandemic and heightened demands for social justice. I'm going to introduce each panelist in order of their presentation. Then we'll have about 90 minutes. I'm going to ask the panelists to spend about 15 minutes setting the stage. Then we'll have questions and answers. The first panelist is Dr. Henry Pettigrew II. He is superintendent of the East Cleveland City School District, where he has coordinated transformational district-wide school improvement strategies. Dr. Pettigrew has built a reputation for delivering actionable instruction, leadership, and offering robust training to building the capacities of both teachers and community leaders. Our second panelist is Joshua Edmonds. Mr. Edmonds is the City of Detroit's inaugural Director of Digital Inclusion and is America's first municipal Director of Digital Inclusion. He is responsible for the creation of Connect 313, which is Detroit's sustainable digital inclusion strategy and is designed to bridge the digital divide. While appointed at City Hall, Mr. Edmonds has testified in front of Congress on various matters of digital equity. He has hosted Detroit's first digital inclusion summit and established the city's first digital equity fund, and most recently has helped to raise a combined $30 million for distance learning and telehealth initiatives for Detroit. Our next panelist is Lucas Macera. Lucas is a community development analyst in the Community Development Department at the Federal Reserve Bank of Cleveland. He joined the bank in June 2020 and conducts research on small business issues, particularly access to credit. Mr. Macera's previous assignments, including reporting on small business for WKSU 89.7, and he has also worked for the University of Michigan's Detroit Neighborhood Entrepreneurs Project. Our last panel is Margaret Mitchell, who is President and CEO of the YMCA of Greater Cleveland. Under Margaret Mitchell's leadership, the YMCA of Greater Cleveland has significantly expanded its budget and services. One of her many accomplishments is the transformation of the YMCA Greater Cleveland's Early Learning Center into a unique preschool model that currently operates the only trauma-informed preschool servicing children and families experiencing homelessness. Notably, Ms. Mitchell has been a leader in the call to declare racism a public health crisis in Cleveland and across the state. Again, there will be an opportunity for questions and answers once the presentations are done. Please do enter your questions as we go along in the questions and answer sections at the bottom of your screen. So let's have at it. Dr. Pettigrew, why don't you start us off?
All right, good afternoon. And hello, everybody. I've been tasked with talking about education and really how the twin pandemic and how COVID especially has affected education from my perspective in East Cleveland, but also you can glean from my perspective other things that are going on in other urban areas. Many of us are going through very similar things. So I want to give you a little bit about the context of where I serve as the CEO and superintendent. And I am the chief executive officer by state takeover. East Cleveland is one of 3 districts that are in academic distress commission, have an academically distressed commission. So there are some challenges and some struggles there. But then also the Board of Education has named me their superintendent after that. So I carry both of those roles. And it's important when we're trying to provide equity and inclusion in our community that we were able to resolve some of those issues. But in East Cleveland, where we are is according to the 2018 census, we are the least connected city in the state of Ohio. So that means broadband access, that means computers in the home, you name it. According to that census survey, we were the least connected, the least that would have those things. And then also, we rank 3rd as the most impoverished city or community in the country, behind South Tucson, Arizona, and Cedarville, Illinois. We're number 3, the most impoverished. So you can imagine that we see our share of challenges and adversities in trying to keep our children educated before the pandemic, but now it becomes very difficult with those type of looming statistics in front of you. And then also we are a food desert as well. I serve a community that we don't have a full-scale grocery store within the 3.3 square miles of East Cleveland, and we currently are talking about hosting the only bank. The school district will have the only bank in the community as well. So definitely trying to give you our context that we have a scarcity of resources. And this was before the pandemic. We were struggling to educate our students. and come up with those innovative and encouraging ways to provide equity for all students. But then the pandemic hit, and it caused us to go remote in a community and a school district where we did not have the internet, we did not have the devices. We started to do what we considered blizzard bags. Some of you may be familiar with that, sending home packets of paper. But historically, we know those things don't get completed or they don't get graded, and it's just problematic, and students don't learn. We also learned during the pandemic, we didn't have a formal way to communicate with students outside of inconsistent phone numbers and emails that change. Really, when the pandemic happened, families had to survive, and they had to find ways to be able to get those resources they needed. And when I started talking about food desert and a financial desert and a digital and a community that was at the bottom in terms of the digital divide, we began to see students walking away from our district, not because they wanted a different community or a different education, but it's because those resources caused them to go stay with grandma, auntie, other family members. That during the pandemic, we saw them and we lost touch with those students despite best efforts. Many communities across the country, it's been well noted, we saw enrollment drop just everywhere. And in the hardest hit areas have been those most impoverished. And we're one of those communities. Students became so transient, where you would be talking to the student this week, but because of something going on in the home or the family, that student needed to withdraw, or that student needed to stop coming to school or stop being online. I will also say that in our district, because no one had the internet, last year we, as a school district, paid for internet access for a whole school year this year for every family that needed it. And we did that through both broadband access, actually putting routers in homes, or through some partnerships and grants. We were able to provide MiFis to families because our community is diverse. So in East Cleveland, not only are we in those 3.3 square miles, but we're also open enrollment. So students are coming to us from a number of different communities. So it just stretches and makes the challenges a little bit more robust. But then also we saw the systemic issues during the pandemic for our students, where the teachers needed to learn how to work remotely. We pushed everything on remote. No one knew what to do. And then last March, we really needed to work hard to try to get our teachers comfortable and capable to teach remotely. But then beyond that, they needed to get to an engagement level so that they can keep students' interest. During the pandemic, during the remote learning, we did give out students Chromebooks and we gave out information, but we saw that it was very complicated to try to educate students during the remote period, especially during a pandemic and during an impoverished community, where students and families had to make choices between being logged on to the computer or dealing with some of those issues at home, or having to go travel places to receive resources. We were one of the communities where, as a school district, we were handing out food to the community and our students. We were also giving out toiletries. We were giving out clothes, food, whatever you needed. We were trying to make sure we supplied that. And we've been doing that since the beginning of the pandemic. But the quarantine process was also impactful in our community in East Cleveland, because when you quarantine, and the first quarantine was by health order, it really restricted students' access to those services and those resources. The hugs that students will receive in an urban school district means so much more than anything you can do remotely. And when the quarantine happened, our students started to suffer when they weren't able to physically contact those individuals in their lives at the school buildings that were their most loved folks. Some students, the only people that would say, I love you, the only people that would care for you in certain instances were people in the buildings. And by quarantine now, by health order, we were remote, and it caused drastic problems to our students. Depression, suicide attempts started to go up, and we really needed to wrap ourselves around our children. We started to make plans to do soft restarts, and many urban schools and schools throughout the country are still talking about that, coming up with ways to start school so that we know that the remote is not helping our children. We know that the remote, we lost many children. So how do you restart? How do you open it back up? And you're in the middle of a pandemic and resources are limited, and COVID is just so robust. We started to have revolving plans on how to restart. I believe we started talking about that in September, then October, November. And every time we did, our Cuyahoga County would send out a notice and say we were at a different level in terms of the red, yellows, or the purples. I forget what those letters, those designations are. And so we had to retool our plans. And every time we had to do that, it had a cause on the families, and as they're trying to plan for transportation, plan for daycare, plan for childcare, we had to make sure we had solid plans. So there was an ebb and flow that was just difficult during the fall semester. But then in East Cleveland, what we decided to do, because there was the reality of this infection spread, so we really had to get smart about cleaning, smart about educating our families about COVID. All of our students don't have high quality access to health care, so we started up telehealth, and we're opening up health clinics where you can get rapid COVID testing as well as other medical advice, medical helps, because these are the things we're seeing now because of the coronavirus pandemic. We're seeing as educators, we're now expanding into the realms more in healthcare, more in the social emotional needs, because it's not just the academics now for the students that have been impacted. They've been drastically and traumatically impacted by this pandemic. So we are drastically now trying to run and come up with strategies to help our students. So we opened up in January of 19, where many schools are still struggling to open up. We have been open. We have about 60% of our students back in school, and then 40% of them by choice are still remote. If you're remote, we allow you to stay as long as your academics and your attendance are up to par. But most of our students have asked to come back. And our families have asked to come back, and they appreciate now being back because during the pandemic, where resources are so limited, and in an impoverished community where, again, resources are limited, doubly limited, the children find solace, they find comfort in the walls of the schools. So we had to find a way to open up our school buildings. So the pandemic, both of them have really caused problems in our school community. Many of our families are struggling. I talk to families on a daily basis about the navigations of life and the complications of school. So that's what we're dealing with in East Cleveland. I believe it's similar in most of the school districts. As I talk to other urban superintendents, I'd be happy to have some conversations about the effects of COVID on education, and even what school districts are doing to try to remedy that. Because as you know, most districts are trying to open up. Most states would like schools to be back open. So that's now the challenge. How do we keep children engaged? How do we keep them safe and learning during this time? So thank you for those comments. I appreciate it.
Thank you, Dr. Pettigrew. We'll come back to you. Next up is Lucas and Sarah. No, Dr. Joshua.
Oh, I'm not a doctor unless you're seeing something in me, and I don't mind that either. But following the very informative words of Dr. Pettigrew, I think that you did a phenomenal job of capturing the way that poverty has exacerbated the conditions of the digital divide during the pandemic. And I would also qualify by saying that, looking at national data, the digital divide is endemic to impoverished areas. And namely, if you're looking at national data around Black communities, whether rural or urban, Black communities are least likely to have high-speed internet, least likely to have computers. And so if we know that already, well, then imagine the back tax that we had to pay by ignoring this issue for so long. And so I think that that's what's coupling and making this issue so pervasive right now. So in Detroit, for example, you read in the bio, we raised about $30 million last year. And it's no secret, our governor and the then President Trump did not get along in Michigan. And so that had a direct result on the amount of CARES Act funding that we could receive. And so it made it very difficult for us to get that federal funding to then begin empowering our students and empowering families across the city of Detroit. But the good thing about my role, and this role does not really exist in a large fashion in other cities across the country, but having a point person within municipal government who goes to bed and wakes up every day, they think about the digital divide and the various impacts that's having on their residents and the structure that needs to be built to counteract that in perpetuity. I see a lot of people sometimes thinking a bit about the tactics of bridging the digital divide. But the tactics are great and they're episodic, but the larger strategy needs to be put in place because there's always going to be some iteration of the digital divide. And so, for example, what we did last year, we had 51,000 public school students. We deployed 47,000 computers. We fundraised for that out of our own pocket within our local community, rallying that. In addition, getting everybody free internet, as well as tech support to support all those families. And that was what we refer to as connected futures. At the same time, last year, we also did what we refer to as connecting seniors. And then we, are now looking at doing a campaign around connecting mothers. And you're seeing this connecting and connected titling that we're doing. All that fits under one umbrella, Connect 313. And so in 2019, when I moved from Cleveland to Detroit, I really prioritized building this ecosystem-wide model because I know the digital divide isn't something that's just going to be relegated to one population. It's pervasive enough that everyone could seek the benefit from it. So what I said was, how do we build a framework where our businesses, like a General Motors, like a Ford, like a Quicken Loans, can have their interests represented because they need to hire from this community. So that digital divide has a strangling role on the workforce. So it's like, okay, we need to be focusing on that part. But then at the same time, I know that there's historic disinvestments in Black communities from my banks. So how do I get online banking to be part of the conversation? And then we flip around and we look at the pervasive nature that the healthcare industry has in reaching the population that is closest to them. And obviously we can look at the Cleveland neighborhoods that are around some of the hospitals and we can see that data there. It's the same thing in Detroit and it's the same thing in urban communities across the board. And so when the pandemic really hit, when we were taking time to make sure that people had the baseline, what they needed of the internet, on the computers, on some basic tech support, we then very quickly realized that there's a whole other game here. I recently wrote an article and I referred to the digital divide as a paradigm of inequity. And if we're looking at this from a paradigm standpoint, when we are looking at the very beginning, I look at the basics. So as folks are going to be talking about people need computers, people need broadband, yes, that is basic. That's tier 1 digital inclusion. So if you do that, great. But there's another tier to it. Once you connect people, what keeps them connected? How are they remaining empowered? How are we keeping families saying, this is something that I want to adopt to in perpetuity? And I think that that's where we're starting to focus on that a bit more now that we've done our upfront advocacy. Just this past Monday, I had a conversation with Commissioner Starks at the FCC, where we had 5 Detroit public school students actually weighing in on legislation that is passed right now, or that is passing right now, that is going to support their distance learning in perpetuity. That is our ability to say that from a municipal lens, we can advocate for what's best for our residents, but at the same time, galvanize key federal stakeholders to get us that hyperlocal impact in perpetuity, so that way we do not have to worry about exhausting philanthropic capital for a historic cyclical issue. And so the digital divide in Detroit and the digital divide in Cleveland and Baltimore and Philadelphia, it looks very similar. The percentage difference don't really matter as much because if I'm a resident in poverty, I'm a resident in poverty. And how residents in poverty interact with the digital divide and how they're affected by it, it's very similar. It doesn't really change. The difference is our interventions need to be tailored in a way where it's scalable, it's replicable, and it can convey the investment confidence that's needed from the federal level to subsidize this. Or again, we run the risk of having an episodic intervention, and then 2-3 years from now, when those computers break, we have to fundraise for 51,000 again, and we're not doing that. And so I think that we're thinking smarter, using the pandemic stories that are really highlighting the digital divide in a way that, quite frankly, we never would have been able to get this advocacy. The pandemic was one heck of a cosigner. If that's the only thing that came out of it, that's great. It's that it co-signed the need to rally support around the digital divide, namely in our Black communities, and empowering Black communities to really take a pronounced leap in the technology adoption landscape.
Thank you, Mr. Doctor. We will now go to Lucas Macera.
All right. So I'm going to shift gears a little bit here and talk about something a little different and focus on small businesses. So first off, thank you to the event organizers for having me speak today. I'm really grateful to be able to raise some awareness around the issues facing small businesses, particularly those owned by Black people. As for a little bit more about my own work, I'm the lead analyst behind our Federal Reserve System Small Business Credit Survey. So it's a survey of about 15,000 small firms across the country. What we ask respondents about a range of issues from, their current financial condition to relationships with lenders. We added a lot of COVID-related questions this year. But one of the most important things we collect in the survey is demographic characteristics of a business. We know that the outcomes and challenges facing businesses are different across the board. We know that white-owned firms have different challenges than Black-owned firms. They have different outcomes. Collecting this data, not every survey does it, but collecting this data is really crucial to understanding the full scope of the small business space. So this fall, I wrote a piece about the disproportionate impact of the pandemic on firms owned by people of color, in particular Black-owned firms. At the time, I wrote about what we knew a few months in, and in short, we saw that white-owned firms were closing at lower rates than Black-owned firms. It seemed like Black-owned firms in March and April, in the really early days of the pandemic, were being hit a lot harder than white-owned firms. When I dug into it, there were probably a few reasons for that, and I wrote about those. First, we knew that prior to the pandemic, Black-owned firms were positioned differently in terms of their finances than white-owned firms. So we knew from our survey and a study from colleagues at the Federal Reserve Bank of New York, they ran some numbers in our survey and found that Black-owned firms in 2019 were twice as likely to be considered either financially distressed or at risk as compared to white-owned firms. And there's also some data that suggests that in the first couple of months of the pandemic, Black-owned firms saw the steepest drop-offs in revenues, especially as compared to white-owned firms. This is problematic for a few reasons, but one of which is that when we surveyed them, Black business owners said that they were more likely than any other racial or ethnic group to turn to personal funds to fill a 2-month revenue loss gap. So we're seeing that financial impacts aren't constrained or confined to the business. They might be spilling over into the household for Black-owned firms disproportionately as well. So prior to the pandemic, we knew that the financial situations were different rather. We also knew that the industry concentration. We knew that the industry concentrations were a little bit different as well. So we know that Black-owned firms tend to be more concentrated in service sectors, which, as it relates to the pandemic, was problematic for a couple of reasons. The first was just the health of the workers. These were workers who were typically dealing with customers face-to-face on a more regular basis, which, during a pandemic that, with an airborne virus, that's problematic. That also made those industries more subject to government mandated closures and restrictions. It was just more difficult to run a business in one of those service sectors during the pandemic. So because Black-owned businesses tended to be concentrated there, they were hit by more government mandates. And the last thing I wrote about was the experience of Black-owned businesses with the popular Paycheck Protection Program. It was the $600 billion plus program intended to give capital to small firms during the pandemic. As it turns out, the experience of Black-owned firms with that program was not the same as that of white-owned firms. So even though I wrote this one piece back in, I think, September, our hunch that Black-owned firms were going to struggle with the program seems like it was right. Our current survey data shows that Black-owned businesses were both less likely to apply to the program, and they were less likely to successfully obtain funds from the program as well. And one reason for this was just prior to the pandemic, Black-owned firms had different relationships with banks. So we know early on that banks were important because they had an established relationship with the SBA through which the Paycheck Protection Program was run. So banks were typically the ones processing loans. They were the ones that were allowed to process the loans. Well, we know that from our survey that firms with relationships or prior relationships with banks, they were more likely to apply for the program and obtain funding. But we also know from our survey that Black-owned firms are less likely to have existing relationships with banks. So if you follow the logic chain there, because there are those different relationships with banks, Black-owned firms seem like they were kind of left out of the fold when it came to the Paycheck Protection Program. We know that they applied less and were less successful at obtaining funding. This is really important in the early days of the crisis when banks were the ones mainly processing the loans or the applications rather. Research from the Brookings Institute showed that businesses in majority Black zip codes often had less cash on hand. So Black business owners in those communities were less likely to have relationships with banks. That in the first couple of weeks of the program, those were really crucial days of the crisis where cash was tight and you couldn't access the PPP program. You might have been more likely to close your business. So when I wrote that piece back in September, we didn't quite know what the magnitude of the pandemic was on Black-owned firms. We had guesses as to why they were facing greater hardship, though. And like I mentioned, we were thinking different financial situations, work in different sectors of the economy, and also the fact that they had different relationships with banks. But with our small business credit survey that we fielded in September and October, we can start to peel back some of the layers and look at what actually happened to Black-owned firms. And it seems like we were right in thinking that Black-owned firms were going to be hit harder by this pandemic. For one, we asked respondents to talk about the current financial condition of their business. 54% of white-owned firms said that their firm was in poor or fair condition as opposed to being in good or very good shape. 77% of Black-owned firms reported poor or fair financial condition. So that's a pretty substantial gap. Overall, Black-owned firms were more likely to report some type of financial challenge in the 12 months leading up to the survey, and more than 3 in 4 said sales would be down more than 25% through 2020. So the outcomes at the time weren't the only thing that were different, though. It looks like the recovery is going to look a little bit different too. We know that for white-owned firms, they said that the primary challenge coming out of the pandemic is just overall demand. For Black-owned firms, they said it's going to be credit. And with our data, it's clear why that's the case. So for white-owned firms, 40% of businesses that said they sought funding said they got all of the financing they needed. For Black-owned firms, they were about 1/3 as likely to say they got all of the financing they needed. So we see this really wide gap in small business financing that's going to be a challenge coming out of the pandemic, it seems. So there are definitely barriers facing Black-owned firms. And it's frustrating to see all of these disparities mount even in the small business space. But it's important for us to continue to dig into this data because Black-owned businesses are really important to their communities and the economy as a whole. We know that Black-owned firms are important sources of employment for Black workers. I've seen studies that say that even when you look at a white-owned business in a Black community versus a Black-owned business in a Black community, the Black-owned business is still more likely to employ a minority worker. So they're a really important source of employment in their communities and nationally. But from a less economic lens, these are really important centerpieces of communities. I've seen studies that say that growing up, children in Black communities are less likely to want to start a business to earn income, but they're more likely to want to start a business to give something to their community, to build something, to give people a place to enjoy. And I think that's really important that we don't lose sight of this stuff, that it's hard for us to quantify, that these are just really important to building up these places in their communities. And I know some of these numbers seem frustrating and they seem bleak when we're talking about the state of Black entrepreneurship, but there were signs of resiliency in our survey worth noting. So despite reporting rougher numbers in 2020, Black-owned firms said that they're more likely to expect revenue and employment growth in 2021 than white-owned firms. And we also ask about the likelihood that the business is going to survive. There really isn't a notable gap between Black and white-owned firms. So that's one of my big takeaways, is that even though we know Black-owned firms were hit so hard in 2020, and they're still facing a lot of barriers that I think need dismantled, that are really inequitable. I take a little bit of optimism away from this, knowing that despite all of this, they still think 2021 looks okay, and they think their businesses are going to be here to stay. Thank you.
Thank you, Lucas. Thank you very much. Let's move on to Margaret Mitchell.
Thank you, Dr. Anglin. And I have to say that I am with the YWCA. It's the W that makes the difference. So I wanted to make sure that I shared that with you. But thank you for the lovely introduction. And this amazing panel it's just been wonderful to hear everyone. I am going to share a little bit about racism as a public health crisis. And certainly we are looking at the two pandemics. And I'm going to go back to 2019 when we were beginning to identify that we really wanted to have a commemoration in Cleveland regarding the 400 years since the start of the commercial end of slavery in 1619. And there were two opportunities for our community to engage in really understanding 400 years of inequity. Of course, this group, CSU, held an amazing two-day conference in the early fall of 2019, and it was an amazing opportunity to dive in, hear from national speakers, and really be part of a planning process that I know Dr. Dunn and others wanted to carry forward. You know, this was not a one-time summit, and so here we are again. And of course, there was a second summit also in Cleveland that was hosted by First Year Cleveland and YWCA that I was involved with, that happened later in the fall in November. And as we began working on looking at 400 years of inequity and really understanding today, or rather in 2019, the impact that slavery has had on America, the impact that slavery has had on Cleveland as a community. And there's no question, you cannot look at slavery and understand the harm that is caused by hundreds of years of being less intelligent, criminalized, raped, sold, beaten, and really told you're not even human. It takes a human toll, a psychological toll, and of course, there's such a strong belief structure around these lies that belief structure put in place realities and systems that continue to adapt to racism again and again and again, or over hundreds of years. So we know that when we look at slavery, some 246, 47 years, and then we look at another 99 years of Jim Crow or legalized slavery or apartheid here in America, we can really see the toll that this has taken. And so the commemorations that happened in Cleveland, and there were certainly other commemorations that happened, really allowed us to dive in 2019. And of course, a centerpiece for us at our summit, 400 Years of Inequity, really was identifying a call to action. And that call to action was recognizing that racism is a public health crisis. And I will tell you, when we started sharing that, talking about that, learning about that in 2019, people weren't as receptive as you would think they would be. I don't think it is the only solution. I don't necessarily think it is the best solution, but it really was a very solid step forward, in my opinion, for a community and a country that has stayed stuck far too long. And so, racism as a public health emergency or a public health crisis, we saw Milwaukee, Wisconsin take this step in May of 2019 by declaring racism a public health crisis. And we began digging in and working with Milwaukee and understanding their thought process and how they had arrived here, and what they were going to do moving forward. And again, it just seemed like a framework that could be important to us as a community. And, certainly there have been other community. Wisconsin is one. Seattle, Washington has created a powerful equity framework in their community that is nearly 10 years old. And so there are definitely cities and counties, all around the country that are taking real steps. We had a first hearing with the city of Cleveland in January. And it was, an opportunity to put before the city council, led by city council president Kevin Kelly, and certainly Councilman Blaine Griffin, and others, really wanted to bring this to the city, not just as a fancy fad, but to really dig in and make change. And in January of 2020, this was pre-pandemic. It was pre-murders of Ahmaud Arbery and Breonna Taylor and George Floyd. We came together as a city to identify that this really did matter to us. And then, of course, the pandemic hit. There have been 2 viruses that have hit America. And I think in both instances, there are viruses that came with warnings. A COVID virus was something that had been on the radar around the world, that it wasn't a if, but a when. And certainly the virus of racism was something that myself and other African Americans have been living with for a lifetime and have seen the inequities over 400 years. And so a colleague recently said to me that, during May and June, as the riots were happening, that he really learned very little during that time. It was, again, just a sad repeat of what has been on display in America for hundreds and hundreds and hundreds of years. And yet I am hopeful that as the county and then the city made the declaration, that there are powerful warriors in this community willing and ready not only to put plans in place, but to take a long view around dismantling racism in our communities. When you think about public health, I don't think, in 2019, everybody got the fullness of what public health meant. It's the public and health, but we were really sort of lost in thinking about the connectivity of public health, not only to health, but to education and housing, wealth gap, criminal justice, and on, longevity, infrastructure, and maternal health, and infant mortality. Public health is linked to all of those things. And now we are able to see it and understand it in a way that I don't think everyone did before. So some have said, okay, you declared racism a public health crisis, so what? And I can tell you that Ohio had one of the largest number of municipalities, certainly at one point in a state, that made the declaration. I think you saw there a number of organizations, including the YWCA, the NAACP, and the Urban League, really coming together across the state of Ohio to work on this declaration in so many of our municipalities, not just in Cleveland or Columbus or Cincinnati, but in small towns and other mid-sized communities. And we see everyone doing something a little bit different. But I believe that we are all centered on understanding the impact anti-Blackness can have. And we here in Cleveland, we see the county doing amazing work, really focused internally on shifting and changing structures within the county itself. And the city work is very much focused and centered on community work, looking to build assets within the community and impact change. You know, I want to just reiterate that this is not a project. And I think that everyone who has spoken before me, you know, what you are hearing is not, there's no short-term solutions, and yet there is, you know, short-term opportunities for us to grab that low-hanging fruit and make change immediately. But we must take a long view as it relates to this work. And we see work happening around the world in Germany and South Africa that have taken a long view that is important for us to take here in Cleveland. Racism is so very, 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 very adaptive. And a backlash not only is coming, will come, but will have a mighty stronghold on this work. And so we must stand together. You know, when we think about this work here at the YWCA, we think about Dr. King and his deep understanding around the arc of righteousness and how it bends towards justice. And we understand that arc to be important to look at addressing. So we think of the A as addressing issues of racism and anti-Blackness. You must address, you must acknowledge, you must understand in all of those pieces what has happened and the depth to which it has happened as an ironclad system. But then you get into the R of the arc and you must get into the redress. You must get into the repair. You must get into the reparation. And the C of the arc is that we've got to stay committed. This untangling 400 years of inequity in our country is not going to be an 18-month project. So we must stay absolutely committed and courageous around doing this work. We must look at the arc in order to pull us forward. And I thank you for having me today.
Thank you so much, Margaret Mitchell. Appreciate your words. I know that we have lots of questions. What I'm going to do is ask a first round of questions as the panelists, then open it up. I'm going to ask Mitty Davis-Jones, my colleague, to help me with the questions from the audience. Let's start with Dr. Pettigrew. Dr. Pettigrew, at the end of your comments, you said that you perhaps like to expand or expound on how we can open up safely in school districts across Cleveland and Ohio. I'm going to allow you the opportunity to tell us how we can open up safely and equitably.
Okay, number one, safely. You know, we're fighting against COVID. So what we've done in East Cleveland is we made sure we do everything with the temperature scanners. When you walk through the building, everyone gets a temperature check or make sure people they have their PPE, they have their masks, their gloves. But we were one of the first districts in this area. We started using Clorox 360 machines. It's an electrostatic sprayer. Spraying everything. We use Microban, Virex. We have 3 or 4 different chemicals with different lengths of staying power. You know, you have to have some intentionality when we have students and they're going to be moving around the buildings to make sure that we have those cleaning regimens in place and make sure that everything is equitable as it needs to be for students. That was the main thing that we had to work out logistically. The other thing is transportation. You know, with CDC guidelines now, a 66 passenger bus, you can only put 11 children on that bus. And that's why you see districts throughout the country wondering how to open, because transportation becomes a very, very big concern. You don't have enough bus drivers. And what we've done is we've tried to go down to using CARES money. We've picked up some vans, some 15 passenger vans. You can transport 6 or 7 students in those vans. And that's the way we're shuttling students around with some non-CDL buses. But the question about how can we open safely, it's about being very intentional. And then we've also gone out to the community, and on our YouTube channel, on our Facebook, we're having public meetings where we're talking about the safety of the buildings and we're sharing the results and sharing the information. That goes a long way to build the trust in the community. And like I said, now we're at over 60% of our students have committed to be in the buildings, and they've picked that as their option. So those safe measures and that communication measures go a long way to bring people back safely.
Thank you, Dr. Pettigrew. Joshua Edmonds, we see the impact of the digital divide under COVID, but we've also lived with the digital divide for maybe 20, 25 years now. Could you give us some examples of how it's been used positively to impact and change communities, especially marginalized communities? I guess I'm asking for a couple of short, great examples of how the digital divide has been overcome.
So, all right, I might not be able to give you the rosier example of the ways that communities have been able to do it, only because for the way we've been historically conceptualizing the issue, we've been missing the mark. And so I don't want to offer an endorsement to say that communities are doing a good job when we haven't. Look at the term digital divide actually is coined by a brother, Larry Irving. He was working in the Clinton administration, and he at the time was looking at the internet in its first role and said, wow, this is a really great tool to empower communities, but not everyone's going to get on the first wave. There will be a digital divide. Now, fast forward to now, historically, most communities are not savvy enough and are not playing the game the right way on the advocacy angle to really afford the unique opportunity for true digital empowerment in a perpetual stance. And so right now, again, as I look at, I'll even make it personal to Cleveland. So fine, a lot of the work that I was doing before I moved to Detroit was in Cleveland too. I worked at CMHA, I also worked at the Cleveland Foundation, so fine, I'll put on the Cleveland hat. When working in Cleveland, I think that there was a lot of communities that we were working with, specifically on trying to find ways to make philanthropic investments into anchor institutions like our libraries to be able to facilitate hotspot lending, to make that a little bit easier for folks. It was about removing barriers, investing in community nonprofit sites that had computer labs, again, being able to get that public trust within a community technology infrastructure standpoint. Those are critical investments that needed to be made. However, one of the big reasons why oh man, I might be oversharing. All right. One of the big reasons why I actually ended up departing from the city of Cleveland was because I didn't really feel that from looking at the administration's priorities, that if digital inequity was not something that was top of mind to say that we are mobilizing as a community to eradicate this issue, I think that everything that we're doing around and the margins is great. I think we're exhausting as much as we can. But if you read in my bio, I'm the first municipal director of digital inclusion. So if municipalities have been historically left out of this equation and they have not allocated their responsibilities and powers accordingly. So I'm not going to offer the endorsement to say, oh, these communities are getting it right, only because the critical piece of advocacy and the ecosystem corraler is missing in that sense. So having a mayor say, I, mayor, whomever, will not have a digital divide in 4 years. That level of boldness has been missing. You're not going to find mayors talking like that. And so the fact that, we're stewarding this as much as we can in Detroit, there's a lot of pressure that came with that, but we're kind of getting on the other side now. Now we're delivering, and now I'm advocating to other cities and Cleveland, because I know who my audience is today, but I'm advocating to other cities to say, hey, in your digital equity arsenal, it's great that you're empowering community ambassadors. It's great that you're knocking on doors. It's great that you're building partnership, but where is your mayor on this? Because that's ultimately going to be the chief advocate that is going to help pull that trigger to release that federal funding. Since the federal funding has been missing from the equation, a lot of people are going to point to philanthropic models and say, wow, philanthropy has stepped up, which philanthropy has. They've done an incredible job. However, they're not best fit to carry this model. It really needs to come from the federal government, who can actually subsidize this in line with the state. If I were to ask you all right now where DeWine's priorities are on broadband, specifically as it relates to the urban context, people aren't really gonna be able to answer that question, because we can't answer that question in Michigan, and most people can't answer that question. And so because of that higher level infrastructure is missing, communities on the ground who are doing work is great, but without that infrastructure, it doesn't really yield me to be able to say, wow, they're doing a great job, only because the big pieces and the more difficult pieces are missing. Now, again, real community engagement is happening. in both Cleveland and Detroit and cities across the country. We have some really great, what we refer to as electronic waste refurbishers. These are workforce development agencies that are able to take in technology from corporations, refurbish those, redistribute them to the community. Cleveland's on a great job of that. Again, Detroit's on a great job of that. Baltimore's on that. I mean, there are communities that are doing that, and that model is a complementary model to what we're talking about. But again, without seeing that full infrastructure in place, I just do not want to endorse any community and saying, well done, because we still need to see people collectively taking that stance. And that stance has not been taken collectively.
Thank you for that answer. Very expansive. Lucas Macera, in doing your research, have you come across models of helping African-American businesses survive and thrive that we should know of?
So that's, in my current work, it's a little bit higher level, but I can speak to some of my past work when I was at the University of Michigan. So that Detroit Neighborhood Entrepreneurs Project that I was a research assistant for, the goal of it was to get students at the University of Michigan in teams to help businesses in Detroit that wanted to help, in particular Black-owned businesses. And the goal of the program, there was almost a sister organization that helped close the gap in funding that kind of acted as a CDFI. But the gap here was also to close, Black-owned businesses struggle to scale up largely because they can't access credit the same way that white-owned firms can. They have to turn to personal funds. There are those inequities and barriers in the way. One thing that white-owned firms can do because they can access credit is, access maybe a consultant to help them with a project. Just get help on things. They're more connected informally in communities to say, a lawyer who can help get a patent through. An accountant, for example, a white business owner is more likely to know an accountant who can help you with, say, like the Paycheck Protection Program application process. And because they have more of those informal links, they can get more free help on certain projects that help grow their business. So DNEP, the program I worked for, tried to fill that gap by just offering free services. And the goal of it wasn't to complete projects for the business owner, but to give them the tools to continue to grow their business once the project was over for the students. So there are a lot of little steps that can be taken along the way that we figured out in our program, like teaching a business owner how to use QuickBooks software so they can kind of play the role of the accountant if they need to. Helping them with little stuff like tweaking some of their marketing programs, because what we know from our current survey, Black-owned businesses tend to be a little bit smaller, and most of them are actually what we call non-employer firms. So, they're businesses that don't have any employees, they're mom and pop shops where it's just one owner or a family of owners, whatever. They have to wear a lot of hats, and they might be really, really good at running a coffee shop. They might be really good at making, whatever widgets, but it's really hard to also wear the hat of the accountant. It's really hard to wear the hat of the marketer. It's really hard to just play all those roles at one time. So what I find is because there's that financing gap really early on, something like a DNEP program where you can come in, just help train these business owners on, how to wear some more of those hats, or teach them what they need to focus on less and how can they can better focus their energy. That's really important early on in the scaling of a business, I think. So yeah, I would say anything that's affordable for small businesses seems to be really helpful. In terms of, helping these businesses access credit, I mean, that's a question that a lot of people in the system much smarter than me have been working on for a long time, and that's tricky and certainly needs to be a priority. But I think, however, we can just be training business owners to be really good at the thing they do, plus some of those other business related things on the side. I think affordable programs go a really long way like that.
Thank you. That's a great answer. I'm going to use, for Margaret Mitchell's question, I'm going to use the question that was asked by my colleague, Dr. Ronnie Dunn. He says here, Margaret, when you refer to the work taking place in Germany and South Africa, I'm thinking of Isabel Wilkerson's work in caste, where she refers to racism as a caste system. Is this the point of your reference? And can you elaborate?
Yes and yes. So Dr. Isabel Wilkerson, who just so happened kicked off our 400 Years of Inequity Summit last November. Her beautifully researched book, Cast, leaves you with no question in your mind that what we have in the United States and certainly around the world when it comes to the color of one's skin is a caste system. And it is a system. It's ironclad, and it is really powerful for you to read the book and to see how officials from Nazi Germany came to the United States and really were in awe of the systems here in place. And yet, after the horrific realities of the Holocaust, what we see in Germany is a country that takes responsibility. So you see them acknowledging and addressing what has happened in their country. And then you see Germany really move into the redress or the repair or the reparation. And you can see pro-Nazi statues all over the world being taken down at the expense of the German government. Even today, to this day, there are still commissions in place in Germany looking at reparations related to healthcare or arts or education in order for the Holocaust never to happen in Germany again. And certainly you do see periodic rises of anti-Semitism in the country and this ability to grab it, tackle it, and pull that thread. And I believe that that is so much of what we have to have the courage. I heard Joshua, talk about courage and boldness. This is what is needed here in order for us to truly make this next pivot. Certainly in South Africa, there is still so much work to be done, but we see truth and reconciliation happening on an ongoing level. And perhaps you would not hold them up as a model. They have a long way to go, and continue to dig in and acknowledge and own just the travesties that have happened there. We seem to be hesitant to acknowledge or own that we are in a caste system, that racism is structural, that there has been significant harm to particularly Black individuals in this country.
Thank you. Thank you. Going back to Dr. Pettigrew. Dr. Pettigrew, I've read where educators are very worried that this is a lost year for students. Do you think it's a lost year?
No, and that's one of the reasons we came back in January, and other districts are coming back. Many are coming back sometime in March. There's still time on the clock. This is like an athletic event where it's fourth quarter of a basketball game, and we're saying the game is already over. I believe in the power, the skill set of the teachers and the administrators in the buildings. They've been waiting eagerly for the students to come back. When they come back, we assess them, and then we begin to give them exactly what they need. So for an East Cleveland, for us, there's still time on the clock. We're not talking about summer school yet. We're talking about how can we help them in fourth quarter, which starts in just a couple of weeks, and how can we calculate and talk about learning loss or instructional loss, depending on which side of the philosophical fence you sit on. But we definitely don't think it's a lost year. We are down this year, and there's been some losses this year, but we do feel that through the prowess of our skilled and gifted teachers and administrators, that we can make up for some of those losses before the end of the school year. So some students won't have loss. There will be some that'll still be needing some interventions. But again, I'm in an urban district, and all the urban districts where many of the students underperform, before COVID, you still had this situation where you had a group of children that needed extensive and intensive supports. So I see this as just another challenge, but this is not a lost year.
Dr. Pettigrew, I appreciate your answer, and I also appreciate the seamless weaving in of the basketball metaphors. That's fantastic. Joshua Edmonds, there's a question in the question and answer I'd like to read to you. It says, since medical professions have begun to use telehealth due to COVID, and you've mentioned Black communities are less likely to have access to broadband internet, combined with being more likely to have undiagnosed psychological distress due to higher COVID death rates, what steps are being taken to reach out to these communities to both bridge the digital divide and effectively treat growing mental health problems? You may not be able to answer all of that, but give it a shot.
I can get on base with this at least.
All right. Oh boy, baseball metaphor now.
Yeah. See. But you know, when looking at, I can speak for our work that we're doing in Detroit in that front. So the state was able to form a racial disparities task force on COVID-19. And off of that, we were able to, they had about $10 million of CARES Act funding left allocated for the state. And we put together a very expensive proposal for $4 million of that 10. And we actually got all 4 million of that, which was great. And that was specifically aimed at telehealth. Now, to give you kind of like the framing that we're operating in around digital divide and understanding that, it usually breaks down from who has access to a device, internet access, obviously, tech support, and some type of skilling, literacy, digital support. And so when we say our Connecting Seniors initiative, money went strategically allocated there, but on the outreach side of that, we were already looking at empowering the anchor institutions that already had that public trust. So thankfully, we have an entity in Detroit called Focus Hope. I'm trying to find the equivalent in my mind in Cleveland. Well, insert any nonprofit that has an aggregate population that is at scale. And so Focus Hope runs a very nice and respectable food distribution program where it actually looks like a store. So it's not like you have to go in there and it's kind of a dehumanizing experience. It's literally, you get a shopping cart, you walk in, you pick up whatever you need. And it's a really nice, well-designed experience. Focus Hope has been doing that since the 60s. And so that trust has already been built. And so when we were able to layer on this telehealth spending and saying, hey, we have $4 million for seniors and their caregivers, because that's where we allocated the funding. So on the caregiver side, if I were to remodel this in Cleveland, I would say that is me allocating money to one of the hospital institutions, pick one, and the caregivers who would then be over the existing seniors that they would like to reach out to, and the outreach would be conducted by, let's just say, Cuyahoga Metropolitan Housing Authority. So CMHA would be able to say, hey, we have 5,000 seniors within these 3 housing estates that we know we need to improve telehealth outcomes. How that would look, you're throwing Case Western Reserve to do any type of research analysis off of the back end of that for lessons that are learned. The outreach would predominantly go to CMHA because they are that trusted entity. So how we did it in Detroit, again, us being able to deploy the funding specifically on the community engagement side for seniors and their caregivers serves as a proof of concept that now that $4 million ask we made last year now becomes a $40 million ask we make next year. And so this is where we've been very strategic by saying community trust is going to be prioritized, and any funding that we get to change outcomes is going to ride through that network where those connections already exist. However, we already know that those community serving organizations, they don't serve everybody. They serve enough people, but they don't serve everybody. So we've also invested in a community ambassador model where you all, in Cleveland, I forgot how many wards there are. There's a lot, but in Detroit, it's easy. 7 political districts, very easy. So we said, hey, let us actually build up our resident capacity within each of those political districts to serve as community ambassadors. So that way, as offerings and new opportunities are emerging, whether it's telehealth, whether it's workforce, it doesn't really matter the what, we at least have the structure that allows us to convey that resident trust. Those community ambassadors can knock on doors that we can't knock on. So anyone that the Focus Hopes or the CMHAs can't reach, we have the community ambassadors who can. And then we have trusted institutions that we have mobilized that then can serve as sites throughout the city. So we have an emphasis on neighborhood technology hubs. So that way, as residents, and I'm going to take this back to the basketball thing and I'm going to stop. As we look at basketball courts in the community, you wonder, where it's like you see a lot of times youth just dribbling basketballs all the time. And I think that people are doing what is reflective of what the community provides. So if there's been an absence of these neighborhood technology hubs, I think that we're allowed to then insert those into the conversation to then get additional resident trust. So on one hand, you hear a community anchor institution, then you hear community ambassadors, then you hear neighborhood technology hubs. That all gets wrapped up in saying, if we want to talk about financial literacy, boom, it's still the same modeled partners. If we want to talk about telehealth, it's still the same modeled partners. And I think that's how we've been able to mobilize. And this year, we're going to be asking for significantly more resources.
Wow, thank you. Lucas Massera, you've heard about the role of the digital divide. Does the digital divide have some resonance for Black businesses under COVID or in general?
Yeah, this is a space where I don't think there's a ton of research right now, but I would assume that it's going to become a problem down the line. So in that, I mentioned a Brookings study that I pulled from. They looked at the role of fintech or online banks in filling the gap where there's a lot of bank consolidation, where large banks are pulling physical branches. If online lenders are becoming the norm, even larger banks are starting to turn to more online banking models. That's problematic if there's a digital divide. If you, as a business owner, can't access, a computer or don't have the internet necessary to apply for a loan online, then you're underbanked. And that's definitely problematic. So I think I've thought about this. This isn't something that we've had the capacity to turn to yet, but I know it's something in the back of our minds when we're thinking about, okay, online lenders have become increasingly more common over the years. Large banks are starting to switch their lending models to be online. That, now it's not, people aren't just going to be physically underbanked where they're not going to have a branch near them. Well, they also might not be able to access those banks through the internet either. So I think we have to start shifting the way we're thinking about what being underbanked looks like to include some of those digital divides as well.
Interesting. Joshua Edmonds, do you want to comment on that?
Yes, and I'm also answering a question in the chat. So I'm not forgetting you. I just haven't hit entered yet. And so on the business side, absolutely. So right now we have a pretty robust effort in Detroit called Detroit Means Business. And that is really us trying to, again, build out this aggregate framework of all of our businesses, namely our small businesses in the city, namely our Black businesses in the city, and saying, how are we affording them the opportunity? Specifically around the digital divide, we noticed that, I'm gonna give you the better example. When I first moved to Detroit, I was really hungry for apple pie. And I don't know why, I was just craving it. And I literally typed in best apple pie in Detroit. And I got what I would say is the worst apple pie in Detroit. Now, the thing is, they were just the best apple pie spot that knew how to use search engine optimization better than everybody else. And so if I'm a Black business and I'm not really aware of the digital tools that are afforded my business, and I don't have a sophisticated point of sale system, this is hindering my growth, it's hindering my visibility. So I think that when we began looking at the role the digital divide plays, if people are going to be underinvested in a historic sense, the minute we start talking about, oh, well, you need to invest in more SEO and search queries, like, what is that? These people have some of the best pies and the best recipes ever, but it's like the minute we begin talking about this sophisticated digital infrastructure, who's really providing the resources there? How are people really being empowered there? And I think that there's a real unique opportunity for businesses to really grow their digital persona. And I think that message has not been communicated clearly enough in Black communities. Yes, we've done a fantastic job on the YouTube, Instagram front. So I know that there's already an inroad that's being established, but I think that needs to extend to some of these smaller businesses that really are knockout businesses. It's just the fact that they don't have the digital presence that they need. And I think that's what's hindering their growth and hindering their survivability, and especially in a COVID economy. Thank you.
I'm going to move to Margaret Mitchell. I'm again going to crib from my colleague, Dr. Dunn. He poses such great questions. He says, can you speak to any specific steps the city of Cleveland has taken to address racial equity since declaring race a public health crisis?
Yes, the declaration for the city came in June of 2020. And since that time, we, and I say we, which includes the city of Cleveland, United Way, NAACP, Birthing Beautiful, and Urban League along with First Year Cleveland. That is the collective. We had sort of organized ourselves before the declaration, and we have worked since that time, since June, to really organize ourselves, define the work, put a framework together for the long run. The city has stepped forward in identifying a commissioner role at the City of Cleveland. This is a new role that will be a commissioner of racial equity and social justice. At the commissioner role is not dependent upon who is mayor. And so, all of these pieces are built for the long view. We anticipate that role will be filled over the next several months. Certainly, I don't see it going past another 12 weeks, and we'll have a new commissioner to announce. We've also been able to define and recruit a steering committee, which will begin to work with co-chairs in the community. This work, so much work in the Black community, and the Brown community in Cleveland happens without the community having a voice, without the community having a role. And we really, if you're going to be centered on racism, if you're going to be centered on Blackness, then we want to be centered in the community. Nothing about me should happen without me. And so we will see community meetings that will happen throughout Cleveland. And really that work is being organized in 5 distinct ways. And those, they're concentric, right? They relate to each other, they build upon each other, they are highly connected to each other. But the work will be organized around health or public health. It will also include wealth gap and infrastructure. We will also have a focus on criminal justice, education, and also on housing. So that will be the work that will be out there, in the community. And so we expect certainly by a June timeframe that our steering committee and our co-chairs will be standing at least 2 of those pillars, if not all of them up. And again, we envision that we want, a level of boldness, not to sit back and think about, let's look at the data. I don't think there's in anybody's mind the realities of racism, in the city. And for the most part, any given list in any of those areas, we sit at the bottom. And it's, it's always shocking to me that is not more alarming, more, sort of the urgency has always sort of been missing for me from this city, not from the residents, but certainly, I think that we've been very, very comfortable for far too long in underperforming, educational systems, digital divide, infant mortality, redlining, all of these pieces. And so we look forward to the work being framed in that way.
Thank you.
I wanted to say one last thing, if I could.
Please.
I want to just invite everybody to join the YWCA in our 21-day challenge, which launches on Monday. You can find our challenge on our website, ywcaofcleveland.org. And the challenge is an opportunity to take a deep dive into key areas and look at inequities in those areas. And so the first week, we will look at reparations. And I do believe this is a very powerful piece of curated content around what is happening with reparations, not only in this country, but in the world, what the history is, where it's worked and where it hasn't worked. So I invite you to join us on the challenge. The other weeks are just as powerful, looking at sports, looking also at gender violence in this country, and environmental racism is how we close our challenge out. It is free. You can access it again during through our website, and we think it is an incredible tool, not only to be engaged in dialogue, but to get your game plan together as an organization or a system around where you are going to dive into change.
Thank you.
Thank you.
Dr. Pettigrew, back to you. I know you are a big proponent of leadership and leadership development. What's happening with your teachers? I know that in some school districts, teachers are overwhelmed and morale is challenged. How are you helping to deal with this with your own teachers?
And that's a very good question. I think when the pandemic started, and remember, we didn't have internet, we were a fiber desert, as I like to say it. Joshua, I don't even know if that's a term, but we didn't have any technology. So one of the things we needed to do is train our teachers. I think we've been very intentional since the beginning of the pandemic. Every 20 days, we have a professional development day led by teachers, designed by teachers, based on the things the teachers say they need. I believe that our educators, the first thing they need is our support. Because it is very difficult. It's challenging trying to teach remotely. If you've ever tried to corral students and get them all to turn their microphones on, cameras on, tell your little sister to stop being, making noise. And then in an impoverished district, many of our children also are making breakfast while they're making breakfast for the siblings while they're trying to be on Zoom learning algebra. I mean, so it's a lot that teachers have to handle. So we really try to be understanding and empathetic with teachers. But then when we started to come back, though, and we got a little bit of an outbreak, so-called, in one of our buildings, I sent all of our teachers home from November, December through January. They all went, they were able to work from home. So it's just that intentionality, trying to keep people safe. I believe our teachers think I have their best interests in terms of making sure they're safe in the buildings, and we're doing everything we can. But then we operate every 20 days in our school district, but we get an opportunity to talk to our teachers, talk to our classified folks, ask them what the problems are, what are the things that are creeping up. We find out when practices that we thought were happening aren't happening. And the folks that are living those things tell you, and then you fix it. Those are the nuts and bolts ways to build trust with teachers and to prevent them from being frustrated, is to support them immediately when they're having issues. And then when they're struggling to find children, and because that was also happening during this digital divide, we enlisted the principals and the central office folks. We all went door knocking, and we started going canvassing the community in support of the teachers to make sure that the teachers felt supported. So the teachers are frustrated. I echo that. But then I also want to say the students are very frustrated. This is the best time of their lives. If you're in high school, they always tell you this is the best time of your life, and it's happening under COVID. So we're also worried about the frustrations of the students. Also, they're screaming at me when I talk to them. We got to get back. We got to get back. This is not normal. So definitely the frustrations are real, but we're trying to do the best that we can by just being a listening ear, and then be responsive when teachers say they're struggling with something. One quick one, we were giving out PPE, and the teachers at one of our special needs buildings, they were saying they need some specialized PPE, and we gave it to them. And I didn't know that those particular items were going to be such a big deal, but that really enthused that staff. So just being attentive to the staff and giving them the things that they need, that's our way of trying to ease that frustration, but it's definitely there.
Thank you. Joshua Edmonds, you successfully deflected my question about best examples. So I'm going to try something different. How about, what's the next frontier for digital equity?
All right. I'm not going to deflect this one. So I think that when, again, from a paradigm standpoint, if people were to understand this as a paradigm, because a lot of times we have people who are really focused on running what I would say a nonprofit model for digital inclusion. There are cities right now where if I were to ask you right now, how much would it cost the city of Cleveland to bridge the digital divide? No one has an answer to that. no one does, because it's like, okay, well, fine. You'd probably tell me, well, it's going to cost this much for internet connectivity, this much for getting everybody a computer, and this much for providing tech support. But that doesn't bridge the digital divide. Those are all immediate measures to understand, okay, you're meeting the moment. But bridging the digital divide, I think that's a conversation where we have to be much more introspective now and say, hey, as communities, as Black people specifically, what are we doing to afford the opportunity for us to compete in the digital ecosystem and to win in that ecosystem? What is that? Because that's a different conversation than let me get people internet. That's the baseline. That is literally minimum wage. Like that is like, if you don't do anything else, we absolutely need to be doing that. So imagine what we lose every single time we don't do that. Every day that passes without that. That makes, like, somehow there needs to be the conversation on the likelihood of us producing tech talent, tech CEOs, tech leadership, and how long families can go without having internet before they start falling out of that conversation. And I think that that's where the next frontier really needs to be focusing on, okay, moving beyond tier one. We are going to connect everyone. The funding that's happening right now at the federal level and the way they're thinking, they're getting it. But we now have a real unique opportunity to say, okay, if this is the case, which we know that is going to be the case, then what are we doing for our communities to position them to be able to thrive beyond just, well, we don't have this, we don't have that, because they will have that. That's how competitive the landscape is. I guess I can't stress that enough. And so I think that from a practitioner standpoint and from a city specific standpoint, it is going to be a real conversation we have on understanding exactly what we mean by when we say the digital divide and exactly what that intervention means for us and our community. And I think that that's the conversation that needs to be had, but historically that conversation hasn't been had. It's always been the episodic, I need 500 computers. I need, internet connectivity for 6 months. And we don't move forward there. It's this horizontal movement, and there's a real unique opportunity for us with the aid that's coming for us to really, really look deeper and to articulate a bolder vision for bridging the digital divide.
Thank you. Lucas Nacera, I probably should have asked this question earlier, but what's in the sample that you studied, or the Black businesses that you studied, what's the cut point or difference between micro businesses and the businesses that you had in your sample?
Yeah, so we follow, I'm forgetting if it's the census or the SBA's definition of a small business, but it's 499 employees or less. So not your traditional idea of a small business, but I guess it's the textbook definition of one. So we do sometimes try to break out our data by the size of the firm. So sometimes when we talk about micro businesses, we're usually talking about businesses that are about 1 to 4 employees. And then anything above that is more of a traditional small business. In the past, we've done whole reports on micro businesses as compared to the full scope of small businesses. I will say most Black-owned businesses fall into that 1 to 4 employee category. So those two things are related when we're talking about the effects on smaller businesses and Black-owned businesses, because most of them tend to be in that 1 to 4 employee category.
Thank you. Margaret Mitchell, general question about the YWCA. Got that one right this time, I hope. How have you dealt with the COVID itself as an institution?
We've been focused on resiliency and self-care. We certainly have all the pieces and protocols in place, just like everybody else, and we're able to provide the PPE and all the other things that are needed for everybody to be able to do their job and to stay safe. But we are a trauma-informed organization, which means that we are very much focused on safety and building trust, understanding collaboration and empowerment. And self-care is a huge piece of what we do. In order to be compassionate to others, you must cultivate compassion within yourself. And so self-care, for a while, self-care has been thought of as, a massage or getting your nails done. And yet we know that in the Black experience, it really is Angela Davis and other women like Audre Lorde who talked about the radicalism of self-care, how self-care is so important to the battle ahead. And so, everybody in our organization, we are just focused there. We're focused on compassion, fatigue, and this has been a tsunami of grief. This has been a season in which we have been afraid for all the Black men in our lives, all the Black women in our lives. It has just been heightened every single day. COVID has just sort of been a little side piece that we've been dealing with, but everything has been on fire. As I've heard Dr. Pettigrew talk and Joshua and Lucas, the patient is having a heart attack and somebody is handing you a Band-Aid. And that is really what we have been dealing with for such a long time, but it is everything in our lives are on fire. So we've been very much focused on compassion and self-care and resiliency as a defiant act. And, we do, we obviously are very focused in racial equity and social justice, but we're also focused on delivering services to the least of these. Among them, we run the largest homeless center for women in the county. We have a preschool also focused on individuals that are experiencing a crisis of housing. And so we do a lot of advocacy around housing justice. And all of this is it's just such a powerful season, to be in. And, we've got the pedal to the metal. And even now you can almost feel people walking away. It's like, I'm a little weary from having this racial equity conversation. It's like, what? I don't get that option. My children don't get that option. Those I serve don't get that option. And we're not shifting away from that gap. But you've got to be present and powerful for it, and take care of yourself.
Thank you for your words. I'm going to give the panel one last opportunity to say a last word or two, and we're going to turn it back to the organizers, the conference organizers. So, Dr. Pettigrew, what's your last word?
I just want to advocate for East Cleveland City Schools. I am the superintendent and CEO. We are a model urban school district. That's what we're becoming. So please pay attention to us because on this front of the twin pandemics, we've always been dealing with the racial inequities, and in East Cleveland, we've been beat up a lot over the decades with redlining and other type of injustice practices. But now we have an opportunity to move in education. We are thinking about jobs, and we are thinking about how to bolster our future of our young people, and we're thinking post-pandemic. So I just want to thank you for offering me this time to represent East Cleveland City Schools and the city of East Cleveland. We are right next to the city of Cleveland. Much of what happens in Cleveland also happens in East Cleveland. We're just so thankful to be in this room with these thought leaders and have this most important conversation. So thank you, and I appreciate the time.
It's we who should be thanking you, sir. Joshua Edmonds, any last words?
Yeah, well, one, it's a privilege to obviously have a great action-oriented conversations with civic leaders that I admire. When I look at Dr. Pettigrew, my niece and nephew are East Cleveland public school students. My sister lives in East Cleveland, and so I mean to see that type of leadership at the top, that's refreshing. And I'll also say that my last words in Cleveland before I left, and I'm wholeheartedly aware that this is an election year in Cleveland. I said that, hey, when y'all are serious about the digital divide, let me know. And I cannot be happier to look at the current pool of challengers. I'm not making this political. I'm just saying that as we are moving forward, we cannot understate the significance enough of municipal investments in the digital divide. And I think that this is a really unique time to surface that issue.
Thank you. Lucas Macera, any last words from you, sir?
Yeah, I would just say that the next report we've got coming out is going to be in early April, and it's going to be the minority-owned firms focus report. So this is something, the effect of the pandemic on firms owned by people of color, but also Black-owned firms as well, is something we're constantly thinking about. And these are issues where we're elevating to people who can do something about this. We're trying to get our data, get our reports in the hands of people who can start closing that divide in the small business space, get access to, or get credit to businesses that have struggled to access it. So we're trying to do our part. So if you're interested, that report should be out in about a month and a half.
Lucas, thank you and the Federal Reserve for your work. It's very good, and we just want to say we appreciate you. Margaret Mitchell, any last words from you?
Well, I would say what we've heard this afternoon as it relates to education and justice and technology and justice and injustice in business. This is not an accident. This didn't just happen. This is a designed system of intent. And as Joshua said, we have an election coming up. It is so important that we have bold, courageous, powerful, action-oriented thinkers leading this city, ranked last in the United States of America in almost every metric that matters to livability of Black people in America. And there are some amazing things happening. We've seen some amazing mayors around this country take some bold steps. And we can too. We must. It's an imperative. Where are we going from here? We've got to do this thing. And as the citizenry, we've got to hold our leadership accountable for driving change.
Indeed, indeed. I want to thank the panel again. It's been my privilege to hear you and just to try and get the word out. And I think we've done that very effectively. And I want to turn this back over to the conference organizers, Dr. Mobley. Everybody have a great weekend.
Thank you, Dr. England. My, what a phenomenal panel. What a phenomenal panel. Thank you to our racial equities panel for that thought-provoking dialogue. There was just so much that we heard that we can take away. But I think what I took away the most was that this is a time for action, that we need to focus on infrastructure that is scalable and sustainable. I think all of our presenters helped us to think about that. And then those three letters of addressing, redressing, and commitment. And the other word I heard that I think is significant as we go forward is courage. I heard Margaret Mitchell use that word. So if we want systemic change to happen, and this panel, this whole conference this year is about action, about moving forward, about where we go from here. I believe this panel today and all the panels have really helped us think about that. Again, if there are any nuggets that stood out for you, please put them in the comments. We want to know what is most meaningful to you. I have had a full day. There's a writer, I'm an English professor, so I'm thinking about the writer, Zora Neale Hurston, who says, I feel like I've grown 10 feet just listening. I feel like I've learned so much from all of our speakers today. So if you do too, please let us know what you learned. Let our speakers know what you appreciated. That brings us to the conclusion of the Project 400 Conference's first day. What an experience we have had. I've learned a lot. We have heard from some phenomenal thought leaders, and I hope you have learned a lot as well. But it's not over. It ain't over. It ain't over, as one of the songs says. We have one more day. Join us right back here at 10 o'clock for another impactful day with more from our informative panelists and talented artists. Enjoy the rest of your day, and I look forward to seeing you tomorrow. Thank you so much. Be sure to complete the evaluation form that we will be providing. We want to have your feedback. Thank you.